Good evening, everyone. Welcome to the school committee and union meeting, COVID statistic workshop that we've been having before our monthly school committee meetings. Sorry, we are late. We were supposed to start at 6:30, but I'd like to start and get right into it with Keith. If you could just give an update regarding the schools.
Yes, so I believe Mary's going to pull up some slides, just our graphics that we'll be publishing every Friday to our website to share. And just to recap as Mary jumps into it, again, this is just our COVID metrics that we look at based on DESE and what the learning model expectation is depending on the number of cases in the community. A reminder of our health and safety measures: hand washing, mask, face covering, physical distancing, and staying home when sick are our key mitigation strategies to ensure we mitigate as much risk as possible. And then just a reminder, when we were at our January 7th meeting, the community had 168 cases in town. We were coming off of our holiday break, so we had no cases in the school. The positivity rate was 6.88%, and 20% of the cases were in children under the age of 18. So for January 15th, there was 191 cases in the town. Again, 0 cases in the schools. We were in the remote learning model. Positivity rate of 7.5%, and 16% of the cases were under the age of 18. So if we go to the next slide, you'll start to see a downward trend in the number of cases in the community as we've progressed through the month of January into early February. So for the week of January 22nd, there was 139 cases in town. We did, based on feedback from the community, begin to divide the cases in another manner to provide some more detail, and broke them up into elementary and secondary. So you'll see we had 1 case at the elementary level and 3 cases at the secondary level. The positivity rate dropped to 6.25%, and 17% of those cases were in children under the age of 18. We also started sharing, as part of the graphic, the number of cases that were based on school transmission. This is based on our contact tracing efforts of our nurse and the public health department and the state public health department. So we didn't have 0 cases for school transmission. We go to the next slide. For the week of January 29th, the cases dropped to 105 cases. We had 5 cases at the elementary level, 1 at the secondary. The positivity rate dropped further to 4.63%, and 20% of the cases were in children under the age of 18, with 0 cases from school transmission. And if we jump to the last one, which was from last Friday, 67 cases townwide, 2 cases at the elementary level, 0 at the secondary level, and the positivity rate dropped further to 3.7%. With 22% of the cases in children under the age of 18, and 0 of the cases based on school transmission. So you'll see over the last month, there's really been a decline in almost all of the statistical areas, except for that percentage in cases for student under the age of 18. That's kind of varied somewhere between 17 and 22% of the cases over the last 5 weeks or so.
Great, thanks, Keith. Did you have?
Yeah, so we can do the last slide too. So sorry, that wasn't in my little summary, but we do track the number of the percent of staff living in the different distinction zones that the state sets. So we have seen that come down, almost flip-flopped. We were up in the 85% of families living in, our employees living in communities that were in red, and now that's 24% with 75% in yellow, which again kind of follows that state trend as the positivity rate and number of cases have come down. More communities have moved out of the high risk zone into the moderate risk.
Great, thank you, Keith. Seems like all a good direction there, but Mark Carleo, our public health director, love to have you weigh in and tell us what's going on at a broader level.
Well, it looks like, excuse me, just to introduce myself, it's Mark Carleo. I'm the public health director for the town. The numbers obviously are moving in the right direction. Anybody can see that. We have our positivity rate right now is down to 3.7% as of last Friday. The average daily incidence rate is was 39 and change as of our last report. Clearly, we're moving away from the holidays is going to be a big part of it. I think we've been hammering the social distancing and mask wearing message hard enough where everybody has heard it at this point. What they choose to do with it is another story, but it seems overall that people have gotten the message and they're heeding it, that they are avoiding the gatherings. We haven't really received as many reports as we have in the past. And our business compliance is up as well. We're receiving very few complaints about our businesses, business cases. Overall, things just seem to be on the decline for COVID. The numbers are just improving every day. I think as of this morning, we had only 58 cases open.
Great, thank you. So like we've done in the past, I'm just going to go around, Mark, and see what questions folks have for you.
Sure.
And Jody, I'd like to start with you this time.
Make sure you don't skip me this time, right?
Exactly.
Good evening, Jody Sheehan, Vice President of the Danvers Teachers Association. I'm also a second grade teacher. Mark, my question is regarding mask wearing, not if we should, because we all know that we should, but the types of masks that people are wearing. It seems like the more science that is coming out is really pushing more surgical masks or the KN95 or KF94, especially with the variants that are kind of floating around. So I was wondering what your thoughts or guidance was on that.
So we've always known an N95 would be more effective, especially if you've been fit tested and you have one that fits you properly. All along, that message has always come with, but don't use those because those are needed in our hospitals. The supply for them, I guess, has eased up. They're a little more readily available. Consumers are able to purchase them generally. I mean, would I recommend that we all start wearing N95s at this point, though? No, I don't believe anybody's recommending that as of now.
Well, it's not necessarily just the N95s, but the KNs and the surgical masks as opposed to cloth masks. Most of the teachers in the building seem to be double masking at this point because that's what is coming out of science. And so I guess we were just looking for guidance from you as to what we can do to stay safe in the buildings.
Sure, that's something that would be probably a little better put together, something a little bit more formally, like a recommendation, if that's what you're looking for.
Yeah.
That would be fine. We'd be happy to do something like that on mask recommendations.
That would be great. Thank you.
Okay.
Great. Kathleen Murphy.
Thanks. Kathleen Murphy, Danvers Teachers Association President and high school teacher. So my question, I actually have two questions. The first one is about the vaccines. I'm wondering what role the Danvers Public Health Department has in supporting the vaccination of educators and school staff in Danvers. Teachers, aides, secretaries, and other school personnel are eager to be vaccinated. And with so many people employed in schools, is there a way to bring the vaccine to the schools in order to avoid absences that may occur if teachers and other educators have to take time during the school day to attend to vaccination appointments at, say, pharmacies or the DoubleTree? So basically looking to see what role the public health department has in helping to facilitate like educator vaccinations.
Sure. So we haven't been asked to provide vaccinations for K through 12 workers when they become eligible at some point soon. Nobody seems to really be sure when that's actually going to become effective. The state, though, overall is their goal seems to be to push as many people to the mass vaccination sites, such as the one that we have in DoubleTree, or the pharmacies like Walgreens or CVS. That'll be performing vaccinations. They're not prioritizing boards of health. Our supply of vaccine that we're able to get from the state is very, very limited. As little as 100 doses a week, in some cases less. So right now we don't have direct plans to actually conduct vaccination clinics. Should the vaccine become available, that could potentially change. So right now it's watching for messaging from the Mass Department of Public Health determining what their recommendations are going to be for K through 12 workers, and then just ensuring that Keith and Lisa have that message and so that they can distribute it to the staff.
Mark, just add some, I guess, just to clarify one point. It's not that we don't wish we could, right? If the state would give us 1,000 doses of the vaccine, we would be happy to be able to implement it because it would be an efficient manner and to be able to do it. But as you said, right,
Yeah.
and we've advocated through Destiny, and I know you've talked with, up through your channels and with Steve Bartha, the town manager, and everybody involved, and just that they really are pushing those mass vaccination sites at the moment as a location for people to go, but that will
Yeah.
continue kind of looking for any avenue we can to try to bring it to us if possible.
There was a second part to your question that I may have missed.
No, I didn't ask it yet. It's a little bit different. The other question I had is, do you expect any type of surge to occur due to the UK variant or any of the others? But it seems like the UK variant is the one that seems most likely to spread quickly. If that should become a lot more common, do you expect that will change that trend that we're seeing, that positive trend, or the trend in a good direction? And if so, is there anything that schools can do to better prepare or best prepare for that type of a surge?
I think that a lot of the things that are already in place or that we're already prepared to do or are doing are what are going to mitigate this exact same situation should that become a prevalent strain in Massachusetts. I believe it's been identified in Massachusetts. We haven't seen widespread cases, but it's the same mitigation that goes into effect, whether it's remote learning, whether it's hybrid learning, mask wearing of any type that's recommended at the time. It's the same mitigation procedures that are going to have to just come into play again until the vaccine is more widely administered.
Okay, thank you.
Sure.
Thank you. Catherine Johnson.
Thank you. I don't have any other questions for Mark. Our aid concerns follow along with the same concerns that the teachers have. So thank you.
Great, thank you. Kathleen Spinelli.
No questions at this time. Thanks to Jody and Kathleen. They asked the questions that all staff have.
I think they've covered for all of us, but I'm going to ask the school committee members too. Mary Beth.
I'm all set. Thank you. Thank you, Mark.
Thank you.
Great. Eric.
My only question, I was going to ask about the variance, and Kathleen did a nice job on that. So I think we understand both the possibilities and the mitigating factors. I do have a question in terms of what you are seeing and from the state in terms of improving the operation of the portals, in terms of people scheduling appointments and getting the vaccine rather, out to mass vaccine sites. It feels like, if not a comedy of errors, things have been going very sluggishly in terms of the actual mechanics of getting the virus into people's arms. And what are you seeing on that from your perspective?
I think sluggish barely even begins to describe it. And there are supply chain issues from the federal government to the state that are hindering things as well. There's a number of issues at hand. But one of the things that is that's a positive, but at the same time is slowing things down, is that the state is building a very robust ability to vaccinate a lot of people very, very quickly. And that's what's taking a little bit of time. If we had more vaccine to actually administer, we'd see the numbers skyrocketing. Our mass vaccination sites would be doing much bigger numbers than they are now.
Okay.
So yeah, there's a myriad of issues. I guess what I would say is everybody needs to just be as patient as they possibly can. The vaccine it's being produced, it's being distributed. These vaccination centers are open, and there are more to come. And just wait until you're eligible, and when you are, do your best to get yourself scheduled. Right now, though, yes, the scheduling, which you mentioned, has been a huge problem, especially for this 75+ crowd.
Okay, thank you.
Great. Jeff.
No questions, thank you.
Great. Arthur?
I'm all set, thanks.
And Mark, you answered all my questions as well. I think getting that recommendation, the mask recommendation will be really helpful, because I had the question about double masking too, and the benefits, and what are good masks and what aren't. So that would be really helpful. I'm sure that information's out there, so you don't have to recreate the wheel, but it'd be great to have that information available to the schools and the community.
Yep, I'll get that out as soon, yeah.
I do have one more brief question. I'm sorry, Mr. Chairman.
That's fine. Go ahead, Eric.
My question is, we're seeing the overall number of cases go down. We're seeing the percentage of positive tests go down. But it does seem like over the last 5 weeks, we're seeing this growth in terms of the number of cases in people under 18. And again, I know it varies 17%, 22, but the trend seems to be a little up in that one age group. Do we know or have any sense of what's driving that, Mark?
Not necessarily. We tend to see, yeah, we're really not sure. It's the lives of these kids are so different and so varied.
Okay.
And then we have that split between 0 to 10 and 11 to 18. It's really tough to say. That's not something that we would necessarily hazard a guess on. I know that, sports continues to be an issue. We continue to see cases there. And then when they, aren't social distancing and they happen to have one kid in the group of friends that are hanging out together, we wind up with cases.
Thank you.
Great. All right, thank you, everyone. I think we will end this, and we'll plan to do this again prior to our March meeting on March 8th. And hopefully we'll even be in a lot better shape then. We're heading in the right direction. So we'll close this out and move to our regularly scheduled school committee meeting just a couple of minutes late here.
All right. Thank you, Mr.
Thank you,
Chairman.
everyone, for joining us.
Take care.
Move into our regularly scheduled school committee meeting. As a reminder, we're asking people to send public comments and questions to publiccomment@danvers.org. As noted on our agenda, any questions or comments that were received by noon today were going to be reviewed and addressed in tonight's meeting. And then additional comments will be addressed after the meeting. So we're going to start by calling the meeting to order with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And the Danvers Public Schools mission statement, which I apologize, I don't have in front of me. And I should know it by heart, but I don't. So we're going to skip that for tonight's meeting, and we'll get to that next meeting.
Dave, I think we may just need to, because we're in the remote setting, just to remind people that we are in the remote settings per the governor's orders.
Thank you. Yes, as Dr. Dana was saying, we are in a remote setting for our meeting. The governor has asked everyone to move away from gatherings in person, and therefore suspended the requirement for open meetings. And because we are not allowed to have more than 10 people gathered, we are still in the remote meeting mode. Which is why, as I mentioned at the beginning, we are taking questions and comments remotely through the email address. So with that, we'll move to information from the superintendent.
Thank you. I think we're on to, I know we have a lot this evening. So items of interest, and yes, Adam Federico has just joined us. So our principal at the Holton Richmond, Adam Federico, will be able to share some wonderful news about one of our health teachers.
Thanks, everybody.
for having me. I will keep this brief. I know there's a lot on the agenda tonight. We're very proud to announce that one of our educators at the middle school, Mr. Jeff Bartlett, has been named the SHAPE District Teacher of the Year. And this is really quite a prestigious award. He was the selected candidate out of a number of candidates who were nominated from over 12 different states and territories. Previously, he was named the Massachusetts Health Teacher of the Year. And then that made him eligible for this award. And this award really recognizes teachers who are outstanding in their instruction across the country. So we're really pleased and proud that Mr. Bartlett was given this award. We're not surprised. He's really one of our top practitioners and really drives our building and drives all of us to be better educators. So congratulations to Mr. Bartlett. We're really proud of you. And we're pleased that he represented the Danvers Public Schools in a national forum. So congratulations, Mr. Bartlett.
Thank you very much, Adam, and congratulations to Jeff.
Yes, any comments from the school committee on this recognition? Jeff?
No, I just think it's a fantastic honor, and particularly when we see that our teachers are being recognized, just not in Massachusetts, but regionally. It says we're on the right track, and we're certainly very appreciative of that. So congratulations.
Great. Eric?
Congratulations, and we're grateful for what you do. We appreciate it.
Arthur?
Same thing. Congratulations to Mr. Bartlett. Not surprised.
And Mary Beth?
Oh, congratulations to Mr. Bartlett. Danvers is very lucky to have him, and I hope he's here for many years to come. Thank you.
Great, and I would say ditto. I wish we had Mr. Bartlett with us tonight, so hopefully he is watching to hear all of our congratulations, because he obviously does a fantastic job, and for those of us who know him and have had kids that have had him, can talk about that firsthand. So thank you so much for coming on and letting everyone know about the award.
Thank you very much.
All right. Any other items of interest for you, Lisa?
All set this evening. Thank you.
Okay. Any items of interest from the superintendent? Sorry, from the school committee. It's been a long day, folks. I'm sorry. Any items of interest from the school committee? Okay, great. I'm just going to add one comment. I kind of mentioned this at the beginning. We did ask for public comment or items of interest from the community to be sent in before noon today. We did not receive any. So I just wanted to make folks aware of that. I did personally, and I'm guessing my colleagues on the school committee also received a flurry of emails this afternoon. I was on back-to-back Zoom calls, so I didn't get to look at any of those. But just want to remind folks that in order to get your comments read aloud publicly at the school committee meetings, please use that public comment email address. Back to the agenda here, and we are going to move to information from our student representative. So Max, take it away.
Hi, thank you, Mr. Thompson. This month, the Anti-Discrimination Club continued to have engaging conversations and lessons focused on important social cultural topics. We continue to reiterate and further educate ourselves on the importance of an accurate historical timeline that represents all races, genders, and sexual orientations. In light of Black History Month, we began to dive into BIPOC representation and, more importantly, why representation matters. Also, we dove a little deeper into researching some powerful leaders in our country, like Audre Lorde, Kamala Harris, and Stacey Abrams. Moving forward, we encourage more students to join these important conversations because being a part of this positive discourse is half the battle. Secondly, I had a direct message from the student leaders in the Anti-Discrimination Club that we have been discussing ad nauseum and are extremely passionate about sharing with the community. As student representative and active advocate for the BIPOC and LGBTQ+ community, I speak for the student body who seeks answers regarding the discovery of the despicable culture of a sports team at our school that came to light several months ago. After 8 long months, we ask what has been implemented to deal with both these student and adult transgressions. No one is asking for any further information or form of punishment or revenge. We simply want solutions to be put in place that prevent incidents and behavior like this to occur again. Ones that are not simply for show, but rather ones that include long-term training and implementation of systems so all people involved can truly understand the severity of their transgressions. In the future, we should be able to look back at the situation as a community and be proud of the progress we've made. But none of this is possible without a progressive and genuine response from our school committee. As Bernice King once said, atonement and accountability are great purveyors of authentic unity. Thank you.
Great. Thank you very much, Max. Any comments or thoughts for Max?
Yes, Mr. Chairman. First of all, thank you for what you're doing, Max. Thank you for coming forward with your statement. David will talk a little later in the meeting about the status of the investigation that, as a school committee, we requested. What I would say to you is that we as a group, I think, take everything that we've heard and we take it very seriously. And we are committed to working toward appropriate response and change to anything that has happened. And we, I think, believe, at least I believe, it's not just involving any single sports team or just doesn't only involve sports altogether. It involves a need to continue and to perhaps get better at creating a culture in all of our schools that values diversity and that encourages all of our students to live up to the expectations of treating each other with dignity that we all deserve. That is not, I don't think in all cases, an easy task. And I think you would probably agree that much of what happens that drives people's viewpoints or shapes how they feel about certain things, shapes how they look at people of other races and LGBTQ people, are things they're exposed to outside of school. And I think we have obviously an obligation and a desire to do more on our part to try and make the atmosphere better, to improve things. But I hope that people from the town listen to what you said and understand what's going on and think about what happens in their own home, in their own neighborhood, in their own family. Because it's such a big issue, as we've seen from the events last spring and summer in the country, and even January 6th in the country. It is a huge problem, and the only way we face it is together, which is something that Americans have always done. So it's a bigger problem than Danvers High School or Danvers, but I think we're committed to doing what we can for this school and this community to make things better. So thank you, Max.
Totally agree. Thank you for your response. I know that the student body and especially some of the other leaders in the Anti-Discrimination Club definitely appreciate being heard on a setting like this. But I believe with the resources that Danvers High has, with some amazing adults, some amazing educators and administrators, that it's definitely not an unreachable goal for further equity for our school system. But I really appreciate your time tonight. Thank you, everyone.
Thank you, Max.
Thank you, Max.
Thank you.
Appreciate it. All right. We are going to move on to information from the superintendent with a facility update from Mr. Taverna.
So we are excited to give an update on the Smith School. It continues to progress. We're looking forward to completion early this summer and looking to move into the new building over the summer. We're doing the exciting phase of picking furniture and ordering furniture right now. So it's really all coming together. Floors are being laid. The tile is in on all of the hallways. And we look forward to actually getting some staff members tours as we get into March and the weather starts to hopefully turn for the better. So it's really all coming together.
Great. Any questions for Keith? Keith, I have one, and I don't know if you had planned this for later in the meeting or not. During our family forum that we had a couple of weeks ago, the question was brought up about, can we use Smith School? Should we need it, the current Smith School? If we're in this environment that we're in the fall. And you said no, because budget wasn't, it was too expensive. It wasn't going to work. And I kind of just took it for that because I had spoken to you previously about it and you had given me more details. Do you have available kind of those details of what those costs are, even at a really high level, so people know that it was looked at as a real possibility And we've ruled it out simply because of the overwhelming expense that we don't have in our budget or our proposed budget to be approved by town meeting.
Yeah, so obviously we wish that we had endless resources that we could do everything we can to educate the kids. And, we always look to make sure that really we're maximizing the resources that we have and leveraging them to make the biggest impact on the students in the school system. For keeping the Smith School open, there would be a variety of costs associated with it. So there would be the fact that we would delay the demolition of the building, which would obviously have an inflationary impact on what it would cost to demolish that building in the future. There would be the cost of keeping the owner's project manager on, as well as the general contractor for an extended period of time. And then in addition to all of that would actually be the staffing of the building. So if we were to keep another building open, we would be looking at more custodians, more teachers, more aides, another nurse, potentially another principal. So all of those have direct costs associated with it that would come out of our operating budget or out of other grant funding that unfortunately at this time just are not available. We're going to continue to look at what we can do creatively. The Smith School is built to, the new Smith School is built to accommodate a population growth over the coming years. So there will be additional room within the building next year. So depending on what the state of the pandemic is at the time and what our distancing we have in place and where the vaccination is at, that will provide us some flexibility to continue to work with having more students in person for learning. There also is the ESSER 2 money, which is the latest, which we'll talk a little bit about later on as well, but which is the latest round of stimulus money that came out in late December, early January, that has a 2-year spending time window. So as we get into our budget hearing tonight, we'll talk about what our base budget is for next year that will be going through town meeting funding, and then using that ESSER 2 money to help us continue to really look at how do we accelerate kids learning, how do we make sure that we have the most kids in person next year, and look to come out of the pandemic on the other side and really catch kids up for what their learning is and what those needs that have evolved and developed over the last calendar year.
Great, thank you. I believe you also told me that there was potential that we would lose some of the reimbursement from the state.
So the way the MSBA program works is that until the project is fully closed out, they hold back 5 to 10% of your last reimbursement payment. So if we were to do that, we would have to further short-term borrow to fund those costs while we're waiting for that reimbursement to come in, as well as they wouldn't cover the cost of inflation and different elements that came from us choosing to delay that demolition. So there's a financial, kind of a two-folded financial penalty if we weren't to keep with the project timeline.
Great, thank you for that. I just didn't want people that were watching to think that we kind of just casually, looked at that and decided it wasn't a reasonable alternative, that the expenses to try and do it were just going to be too great. And like you said, we'd love to be able to spend, as much money as possible to educate our kids, but we have a budget that we have to work within. So thank you for that clarification. All right, we're going to move to new business. Next steps in educating during the pandemic.
Thank you. So for this meeting, we have moved the normal presentation that would be under information from the superintendent to new business. So I would ask to read the motion first and ask for the school committee to move that motion, and then we will do the presentation, which leads to the school committee discussion before your actual vote. So at this time, the superintendent recommends the approval of the increased student learning time plan at the elementary level to begin on Monday, February 22nd, 2021. This proposal includes transitioning grades 2 and 3 to a 4-day in-person learning model, which maintains our mitigation strategies, including 6 feet between desks, and providing additional live instruction time for grades 4 and 5 during hybrid remote days. Thus, all K-5 students will have at least 38 hours of structured learning time every 2 weeks.
So we need a motion, please.
That's so moved.
Second.
Okay, we have a motion and a second. Diane, if we could do a roll call vote.
David Thompson,
Yes.
Eric Crane.
Mr. Chairman, we need to have discussion before we can take a vote. I suggest you,
Okay, my error. So we'll do the presentation first and then discussion,
yes,
then vote. Thank you for the clarification.
no problem.
Thank you. Okay. Educating during a pandemic, I will begin with the overview, and then Mary will be able to give the details of the plan at the elementary level, and Keith will be able to give us updates from the state level also, and then I'll come back at the closing piece of it. So again, we continue with this slide at every meeting. It's very important because this is what drives our work, that Danvers Public Schools is an equity-seeking district that includes our physical safety, our emotional safety, and equitable learning environments. And even that picture gives us an indication of an equitable learning environment, really looks at the needs of all of our students and how we are approaching that. So in any of our plans, we are looking at all students, although we may not specifically talk about a specific group. It is our work and our responsibility to review all of our plans for all students, and that we continue to work with individual families to be able to address the needs of their children. So again, I hope that our parents will continue to reach out to principals, teachers, and their school social workers for support around their academics and their social emotional well-being as we move through this pandemic. This will continue at different times because it is so important to see it more than once, that the mitigation strategies, and it's the combination of these strategies that we continue to have that success in our schools that you saw during the statistics workshop that we had earlier. And in looking at this for the mitigation strategies, we have heard over the weekend that the CDC should be providing updated guidance for schools this week. So we will review that and be able to share that with our next steps for the school committee. The next slide has the recommended vote that I described at the beginning of the presentation. And again, looking at it would be for February 22nd with grades 2 and 3 to transition to the 4-day in-person learning model using our mitigation strategies, including the 6 feet of distancing. We'll add additional remote live instruction time for our 4th and 5th graders, and all of our students at the elementary level K-5 will have 38 hours or more of structured learning time over a 2-week period. And again, those are terms through DESE that we continue to work with DESE. There was a webinar this afternoon for central office that we gathered additional information today. And at this point, I'm going to turn it over to Mary, who will be able to talk about the how and the details of our plan.
Great, thank you. So we had to tackle many logistical issues to develop this plan. So, but our priority was to keep the mitigation strategies that have worked so well for us in this school year. So our main one was to maintain the 6 feet of distancing between the desks. To have this plan come to fruition, we had to add teachers at 3 schools. We're using teacher aides that were either already had a teacher license or are in the process of becoming certified. We use larger spaces at 2 of the schools. One case at Smith, we were moving walls and moving classrooms. And then we also utilized the state supplemental budget and appropriation for staffing, for the modifications, and for the supplies needed for the additional classrooms. There were challenges as we were tackling the logistics. We found that we need to keep the gym and cafeterias available for lunches, that the staffing was becoming an issue, that unless we had everyone in a central location like the gym and cafeteria, it was really difficult to help out with those lunches. All the classroom space in our schools now is being used, bringing back grades 2 and 3. And it's difficult to try to accomplish that for grades 4 and 5, and we couldn't get that done. Our cleaning schedule had to become more robust now that we have more students, in schools daily. So our details of the plans. So the school-based changes. We did not need additional staff at Highlands, Riverside, and Smith. That's where the modifications were made, or the movement. So at Highlands, we moved classes to larger spaces. At Riverside and Smith, we made adjustments to the current classroom space. Thorpe and Great Oak will be adding both a second grade and a third grade classroom in order to fit more students back at schools. So there's an additional classroom at each of those grades at Great Oak and Thorpe. The hybrid live learning time actually changes, and it changes for all grade levels. So obviously with the K-3 back at school for 4 days, that increase is up to where it is for K and 1. K-5, we are reducing the number of mass breaks. That increased the amount of live time. And then we also increased in grades 4 and 5 the live synchronous instruction time that we have during the hybrid remote days. So now that grade 4 and 5 on their remote hybrid days, they're going to have 2 3/4 hours of live instructions during those 2 days. So grade 4 is going to have an hour of math, an hour of ELA, 30 minutes of science, and a 50-minute check-in. That is what is required by the Department of Ed, that check-in for every day that you are out remote. And then at grade 5, they'll have an hour of math, an hour of science, 30 minutes of reading, and a 15-minute check-in. Wednesdays is for both hybrid and remote is changing, and they'll be lengthened now from 8:30 all the way out to 1:15 p.m. And this is going to include a 30-minute lunch, a 15-minute break, and 30-minute specialists for all students. And that's different from what it's been in the past. At the full remote, students are also getting more instruction. So K-2, the teacher will be with their class all day long, and we're adding 20-minute specialists each day. There's an asterisk, as you see this on each of the specialist times, because Wednesdays, because it's a shortened day, the specialist time gets shortened as well. So just to know, that's what's there for. At grade 3, the full remote students have an additional hour with their teacher and a 20-minute specialist each day. And then at grade 4 and 5, the students have an additional half an hour with their teacher and a 40-minute specialist class each day. And again, 4 and 5 is because they're also working with the hybrid students that are home during the remote day. So that's why there's a difference in that amount of time. So this all results into the following times. So you can see K-3 in the hybrid program, we have 45 hours of instruction, 45 hours and 20 minutes. And the current time is down below. So the current at K and 1 was 42 hours. The current time at grade 2 is only 29. So that jumped to 45 because they're coming back to school is a significant one. And then at grade 3, 45 hours and 20 minutes will now be the time after vacation, and their current time is 31. And again, remember, these hours are for 10 school days or 2 weeks. That's how the Department of Ed is quantifying them. Grade 4 and 5, they are remaining in their hybrid program where they're on 2 days and then home for another 2 days. So they go to 38 hours and 40 minutes. And at both grade levels. At grade 4, they currently are at 31 hours. And at grade 5, they're currently at 28. So you can see that we were able to add some good live time there. The full remote program also has hours increased. K-2, we have 42 hours and 10 minutes. That's up from the current 28 minutes that they're getting. Grade 3 is getting grade 3, 4, and 5 get around 38 hours, and they currently are at 28. So that's the amount of resulting time. At this time, I'm going to turn it over to Keith for giving you updates.
So as we look at other updates from the Department of Education, so as Lisa mentioned earlier, there was a structured learning time additional webinar today, and the state will be looking at doing another data collection to collect where districts are at kind of post-holidays as we get into the second half of the year. We continue to explore the high school senior internship and education program. So we have sent 6 of our students over to the Workforce Investment Board to work with them to do a formal internship within our elementary and I believe just our elementary schools coming up during the month of February into March and April. We have implemented the Binex rapid testing program, which we talked about, that went full-fledged last Monday, once we finally figured out our last piece of disposing of some of the hazardous materials and working through all of those details. And then, as we talked a little bit about earlier, the ESSER 2 funding, that's our long-term funding that is running through 9/30/2023. So again, as we move into next year and really as we dive into the springtime, is starting to make plans for the future and how we, acknowledging that kids have lost some of their education over the last calendar year, how do we look to accelerate some of their learning and close some of those gaps that have developed as we move into the future. Good. Thank you, Mary. And then vaccination, we were able to talk a little bit about this also at our special workshop before the meeting, but K-12 education is in phase 2. They're step 3 of that phase after 75-year-olds and after 65-year-olds and those with 2 comorbidities. They are the priority group. The next group of, workers as we might define it, after first responders. So we are hopeful still that will be somewhere in the start in February at some point, and be completed by April. We continue to await for more information from the state and DESE, as Mark was saying. They are pushing people towards the mass vaccination site, but there is an acknowledgement at the local level that we're trying to push up through the state that education is a little bit different, and that, coverage for teachers, while they need to get the vaccine, that it may need to look a little different for us to make sure that everybody can get it, get the vaccination in a efficient manner that also allows for schools to remain open. And we have had those conversations with our public health nurse and public health director. And then I think we're going to turn it back over to Lisa to.
Thank you. So we continue to share that we are committed to bringing all of our students back into our buildings as the state and the national state and at our local level as things continue to evolve. So we continue on a monthly basis to monitor, plan, and to update the community and to bring recommendations to our school committee. So looking ahead, we can expect that the CDC is letting us know that they will have an updated guidance. We expect it later this week. That will be information that is much needed as to the next steps for education. We continue with union negotiations. As Keith said, we will continue to monitor the state vaccination plan to have all of our K-12 staff have their vaccinations as soon as possible. And we will be planning for summer in FY22 also, along with, as we have done every month, with the continual review and analysis of our hybrid and remote plans. Thank you.
Great. Thank you all very much. A lot to go through. Jeff, would you like to start?
Sure. Can we go to slide 5 real quick again? I thought that was a good slide that kind of showed an overview. Sorry for the last second. Making you switch in there. Yeah, if you go back. Right, so I thought this was a good slide because, as Dave mentioned, we've been getting a lot of questions lately regarding, well, what if you just fix a couple of these things, right? What if you go from 6 feet to 4 feet? What if you go to 3 feet? Then we can all be in school tomorrow, right? Well, no, I mean, there's a lot of other things. What I liked about this was it highlights a few of the things, right? There are several things. There is not one thing that is going to magically get us all back, but this is part of the discussion, right? So it's yes, 6 feet, 4 feet, 3 feet. Okay, we can talk about that, right? The teachers, right? You obviously need more teachers with the right skills, with the right abilities to be available, right? And that was one of the Smith School issues that we talked about. The spacing, even if you had the teachers in the 6 feet, 4 feet, do you have the right configuration? Do you have the right spacing? Do you have the right cleaning? So I like that we've sort of thought through this and kind of laid this out for people so they understand where some of this is. Now, does this mean that this is everything? No, but it is good that we're kind of bringing this more to the forefront. And if these things can be resolved, it's good that we've got a plan to bring more students back. So I guess my next question is, clearly these grades were important for us to bring back for a variety of reasons, which we've talked about. what is our next set of student population that we would consider if we were able to mitigate and improve some of these things? Do we have a sense? Is it special education? Is it students on certain IEPs? Is it older students because maybe they can, wear masks better? What's sort of the next set of priority students that we would be considering if we were able to look at some of these?
My initial answer would be it's all of our students. It's the next grouping is looking at the information of the CDC, looking at the number of factors, working with the state for changes that would need to also happen at the state level. So all of those factors need to come into play as to what is needed at each grade, at each level. So the elementary, we have questions over the Wednesday piece, but we've talked about that. The recommendation for this evening is the same as the K1 at the moment, and that is really looking at taking it one step at a time with looking at all of our mitigation strategies, and as we change a part of it, making sure that's working before we're moving forward. So one of the challenges is to continue taking a look at our cleaning schedule, and that's the deeper cleaning of what happens. And yes, some of it is happening after 3 o'clock, but there are pieces that happen between 7 and 3 also. So, and we know it's difficult that parents and the community get pieces of the information, and it is difficult to give the entire full picture, and that we're working in those details every single day. So I would encourage parents to continue asking principals questions, asking administration and central office questions, and we can help to piece those details together.
Okay, yeah, because I would imagine each of these, depending on the context, if we were able to solve, would still, let's assume you had a popular, I'm making this up, right? Middle school, and let's say middle school is a priority next. Well, you'd have to have space in the middle school, right? Having space available in the elementary schools wouldn't necessarily help that. It's similar with teachers and capacity there as well. So that makes sense. So in a similar vein, the ability to go and do more remote live learning and teaching, any of these, I mean, not obviously the physical spaces are not, or maybe they are, ones that we've been able to sort of solve. What other constraints do we have in terms of increasing the amount of remote live learning time? Is it, our teachers are at capacity right now? Is it a technology issue? What specifically is it that we've been able to do for this adjusted plan? And is there a way to sort of accelerate that in the future?
It is, Mary, you want to take that? Mary has worked closely with the elementary team, so let's have Mary.
Yeah, no, that we are at full capacity of our teachers being able to teach, both the teachers in school and the teachers that are out teaching remotely. So through this plan, we've looked at everyone's schedules, looked at any kind of extra time that might be available, and we are at the max. And we will be, we need to utilize teacher aides for anyone that is absent from school, both in the hybrid model and then also on the full remote. So there again, the coverage is difficult. So when someone needs to be out, in fact, on the remote days, we have all our staff working, including our, math coaches has regular schedule, but then she also has to cover if someone's absent. Julie Pasternak, our elementary curriculum director, is teaching both during the remote days with a regular schedule, as well as covering for teachers that are out. So we are at full capacity. We have every adult really working to do that work.
Okay.
I would also add a piece in looking at, our responsibility is educating all of our students. And we understand that we have that range of responses. And when we present the information and the decisions that we've made, it's based on what we need for all of our students. So having a fully remote option for families, that is a state requirement this year, that we do provide that. And I think that's been one of the questions that we can continue to get around. Why did we not choose the state-run program? And again, we can have individual conversations to help members of our community with that understanding. In the end, we decided, again, in looking at what was available and the vendors and how the program was going to work, it wasn't what we thought eventually in the beginning. And that's what this entire year, a learning process for us has continued to be, is that everything continues to evolve. And information, we're trying to get information out as quickly as possible. It may not always be fully fledged out and all the details. So when we have to make that final decision, it could change. So in the final decision, it was made that we would have our teachers. And with that, there are some scheduling challenges that we have. We continue to overcome those challenges. But we are looking at, as Mary said, the capacity. But I did want to point that out, that those are decisions that we've made for all of our students. And we hope that that doesn't have one group of parents against another group of parents, that and looking at the resources and how we're allocating our resources.
That's good. And I think that's fair. I mean, it is difficult to balance, and I do appreciate all of the emails that have been sent. Some of them have been very pointed, which is fine. I mean, they're all good. All feedback is good. So we need to see that. We need to see where there might be areas we could improve. And is it going as fast as we would like? Probably not, right? I mean, a lot of things are changing as we speak in terms of where the community is, and in terms of the spread, where we are in terms of having the vaccines available. This is just a small part of it, but people should understand that we do have these in place. And I think some of the feedback we got last time, right, which was, well, you didn't give us enough time or enough warning for some of these things. This is 2 weeks, right? This is 2 weeks this would be implemented if we vote to approve it today. So hopefully if we do go ahead with this, then that is enough time for folks as well where we're going forward. So those are the majority of my questions. I'm sure a lot of other folks are going to have others as well, but thank you for bringing this to light and pulling it together, and we'll certainly talk more about it. Thanks.
Great, thanks, Jeff. Eric?
Thank you, Mr. Chairman. Lisa and Mary and Keith, if I could, I want to ask some sort of specific questions that we've received from people by email during the course of the week, and things that I think make sense to talk about. We've had some concern from a couple of different folks about non-certified teachers in the elementary level, and I'm wondering if you could address that in terms of, in general, how we're looking at qualifications of folks. Is that accurate? Can you address that piece, Lisa?
Thank you. I would ask Keith to take that first, as Keith oversees the human resources in his work with DESE.
Thank you.
So there's a few different factors that come with that and different regulations through DESE, but we're looking for the individuals that we think are the most qualified to work with the kids. Oftentimes that is a staff member who may already be in the building that has relationships with some of the kids and the other staff members, as we look at team teaching and some other innovative ways to go about the second half of the year to ensure that we have the smaller class sizes and that everybody is successful. One thing is, technically under the Massachusetts law, if a teacher is in the classroom for less than 90 days, they are not required to have a teaching license. That's how the regulations work. We do think it's important that everybody still does. So the staff members that will be becoming kind of the long-term substitutes, the teachers for the second half of the year, we are working with them so that they should all be licensed by the time that we do start on February 22nd. There are some different provisions as we're going through an ongoing pandemic for emergency license, not waivers, but granting people emergency licenses. So we're working through with the staff members that will be taking on those classrooms to get one of those emergency licenses or finish their licensure process in the traditional manner, depending on where they are at.
So how sure can people be, can we give them some assurance that the person who's going to be teaching their student is really going to be qualified to do what we're asking them to do?
that is what we're working through, is to make sure they have those qualifications on paper. We wouldn't be asking any staff member to be in front of a classroom if we didn't believe that they were qualified and the best person to do it, to the best person to work with the students.
Okay. Just, recognize this is a concern of some folks, and, I think we should be transparent about it as we go forward. And I know you guys are working toward the licensing, and that's great.
And we are taking it as an opportunity. We've been talking about, since we started visioning for the Smith School, about team teaching and teachers working together and how you group and regroup students. And so really looking at this being an opportunity to also pilot some of those innovative ideas, and, making the most out of a bad situation about how we can continue to innovate what education looks like.
Sure. I had a question, not totally on point, but not really off point. And I know, Mary, you talked about it last month, but I did hear from someone who wasn't clear on how we're handling MCAS this year. The state has decided to go ahead with MCAS. Can you tell us when the test will be administered in Danvers, in terms of how that will look with more kids coming back, but still a lot of kids remote? How's it going to all look, and what's the timing?
Right, we're still looking for guidance from the Department of Education. They did tell us that we are testing, 3 through 8, except that they're calling it a sampling approach. So they're only making us take one session per content area. So there'll be one session for ELA, one session for math, and one session for science if you're in grade 5 or in 8. So right now, they haven't talked too much about the logistics. I did get an answer. I emailed the Department of Education and asked about our remote learners, and they're asking that we do test them, although other districts have heard a different answer to that. So we will see what that brings. So again, we're still waiting for guidance on the particulars. We haven't, our plans are to continue to do our testing in a similar fashion in the classroom like we have been doing in grades 3 through 8. And then if the remote students are getting tested, we were thinking that, potentially a Wednesday might be a way to have them come into the school where not everyone's in school at the same time with them, and try to do a testing session then. And again, remember, the testing sessions are designed for around 60 minutes, and it could go a little longer than that, or, it's on time. But again, we feel like students would take for one session, somewhere between 1 and 2 hours. But right now, again, no details, so I can't say for sure what it will look like exactly when it comes to April. So the testing window is April through May.
As we start to bring more and more students back, what will happen to the student? Like, are parents still going to be able to opt for fully remote if that's appropriate for their family in light of the pandemic? And if they do we have plans in place to make sure that, the more and more we come back, that we're not forgetting the needs of the remote folks?
At the moment, the state still has that requirement. So we go with the most up-to-date information that we have. So our families would. We continue to, especially at the elementary level and the decisions that we're making, taking a look at space as availability. And so space is getting tighter, but we continue to work with families and looking at their needs and the spacing within our 5 elementary schools for going back and forth between hybrid and remote.
Mm-hmm. A general question about, I'm under the impression, and you've got to correct me if I'm wrong, that when students are out due to being quarantined, are they able to participate in their classes online or not? How does that work? And if not, why not?
They, for the most part, are not. In looking at our work with our teachers and at the beginning of the school year, especially at the high school level, there were a couple of areas, the AP courses and the some of our special ed area classes that needed to have that flexibility for students and for the students to be able to do the live streaming, to be part of sort of the hybrid class of having some students within the class and some students there. But as far as the quarantining, we really have looked at that as in other years, if a student was out sick, we didn't have that technology. So we continue with the focus on the days that students are in school. Those are the times that we want the teacher focused in on the instruction with the students in front of them. And we have not, and the bandwidth of capabilities to open up the entire district. And again, Keith and Mary can add more if you needed more clarification with specific details, but it was a decision in working together collaboratively with our teachers and looking at the way we have done things and how we are doing it in a pandemic, that the quarantine student, if a student is quarantining, that they have not been able to sort of the beaming in, the live streaming into that class for that time. Okay.
I have anything more to add to that. Yeah, I don't have any more information than that.
Yeah. And I think, I'm not sure if Mr. Crean, his technology may have frozen at this point. So I think
Okay,
he'll
good. I
join.
thought I was waiting.
Right. I think he'll join us
for a
again in a
moment.
moment.
Must jumped off and we'll be jumping back in. Here he comes.
Sorry, I lost my internet at just the right time, right? Okay, I didn't hear the very end of your answer, Lisa. But I guess what I would say is, you know, if we can find a way to increase opportunities for those students to stay engaged, because lots of times they're not quarantining because they're sick, they're quarantining because they're a close contact. And given the difficulty already in the hours that we're trying to get for students, anything we could do to help them, I think would be a good idea. I do hear what you're saying, but if we can keep that on the front burner, so to speak, that'd be good. The other question, last question I had, really, Mr. Chairman, is what are we hearing from the state in terms of that pool testing program? Who's paying for it? That 6 week, I think they were going to initially pay for 6 weeks. Then, so what is the status of that now?
So we do continue to discuss that, obviously, with our, as part of our work with the nurses inside the school building and with our student services department who helps to oversee that. And right now we're in a phase of trying to explore outside staff that could do the testing for us based on our internal capacity to actually do the swabs and run the program. Those expenses weren't necessarily covered as part of the DESE pilot program, and it is more abstract. If you need them, we can see what we can try to do for you, but it's only going to be good until this date. And basically the districts that can do the staffing on their own is the preferred manner. You should be talking to your nurses internally, and those are the people we're going to prioritize.
It sounded a lot more promising in the beginning than it seems to have developed.
It did. And we've kind of got to the point where looking at all of the factors, we're not sure if it's really going to be the best fit for us based on really those staffing restrictions and not being able to have the people to do that, and utilizing our nurses' professional expertise about who really should be the ones running the program and what their medical expertise says.
Okay. All right. Thank you. I'm generally positively disposed on getting more students back at this point, given that we can maintain that 6 feet distance, which is, I think, important. The only other thing I would say is that, you know, I think the phased in approach in the elementary school makes sense, and I'm sure this is happening, but as we're thinking, okay, maybe 4th and 5th grade next, or 3rd and 4th, we can also, I think, at the same time, I hope we're looking at the middle school and high school. They have different issues, different concerns, but the goal is the same. So we could probably look at that as well, sort of at the same time we're looking at the other elementary grades. All right. Thank you, Mr. Chairman.
Great. Thank you, Eric. Mary Beth?
Okay, thank you. So some questions. With the new model for K-3, what will snow days look like? Because I know last week's snow day, you know, high school and middle school did one thing, elementary did something a little different. I understand that there were different options, but with the K-3 in school 4 days a week, what will snow days look like for them?
It would look like the more like the middle school and high school for and to explain that to families. It would be taking your day of what you would have in school on that Monday, Tuesday, Thursday, Friday, if there was a snow day on any one of those 4 days, in turning that into a remote day. Very similar to when we went to the short-term remote plan. The elementary parents could expect that in going forward. So we did look at a different plan last week when we had us, when snow was coming and turning it into a remote day of trying to balance off. Again, we get a range of responses and feedback from our community, and that was one way of trying to do that. So, but again, as we move into a 4-day program, it automatically goes to turning an in-school day into a remote day following that very similar schedule for all of the students.
Even 4th and 5th grade.
Thank you for that clarification. Yes, we would do that. We would make that consistent for our elementary schools. Yes, thank you.
Let's see. What about the services in the elementary school, like Title I, speech, OT? How are those continuing? Are they going to be, interrupted by this? Just what is that? What does those schedules look like?
Thank you. So Mary could answer that too. Mary has, in the elementary team, have been looking at schedules nonstop.
Yes. So OTPT are going to stay on the same schedule because they're outside contractors to our school district. So we will keep that schedule the same. Special education is going to work to might have to change their schedule a little bit to conform to the changes that were made in the schedule, or if that was unable to do, obviously the priority is to the special education services. So that's there. I forget, what was the other part of your question?
Title I.
Oh,
Title I, Mary.
So we go back to the Danvers High interns, because our Title I services have been fully remote right now. So the Title I teachers have been working remotely. And what we're going to do is use the DHS interns to be the supervisor in the room, physical room with the students, as the students are getting remotely serviced by the Title I teachers. So they'll be on a Chromebook getting services from the Title I teacher, but in the room will be the Danvers High intern to monitor the students.
Okay.
And bring them back and forth to the classroom.
Okay. So knowing, especially having a child with an IEP, I know every IEP is individualized. So really any families that are, whose students are having issues or needing additional help and support, or parents that have questions, we're recommending that they reach out to the classroom teacher. Is that correct? Or the principal?
Maybe the special ed liaison.
Right.
Or the teacher.
Coordinator.
Yeah, coordinator. Yeah.
Okay. Just so that folks know that they can always do that, correct?
Yes.
Yes.
And I do think this is just, Mary Beth, just real quick, a good opportunity just to say thank you. I guess really Julie and her team in the Curriculum Center really have taken the lead on doing all of the schedules, but really all of the teachers across the district. This is a major change for all of them for mid-year, right? Coming out of a February break, and probably major change number 3 that we've had. And it's just a chance to say thank you to all of them who really have stepped up. And we said, well, maybe we're going to think about putting you in the gym. And some of them said, well, no, I want to stay in my classroom because I can do X, Y, and Z. And what about this idea? And they really jumped in the deep end with us to try to make this plan come to life. And just an opportunity to say thank you to all of them for really buying into this with us and jumping in.
No, I agree. And I want to thank all the staff. And I think, it's a collaboration amongst everyone to be able to move forward, to get kids back into school. And so again, yes, I agree with you, Keith. Definitely. Thank you, everyone. The new teachers, let me see. I just wrote down some notes while I was going along. Again, to what Eric was saying about the quarantining and the live instruction when they're quarantining. And I understand we talked about this, Lisa, and yes, like a regular, sick day and all, but these kids are missing potentially 10 to 14 days where they can only do whatever work is posted. And I've witnessed 2 students that have been out on quarantine who, it's stressful for them to try to keep up, not seeing the lesson being presented live, and then trying to come up with, get all that work done. So at least on the middle and high school level, or at least the high school level, maybe trying to figure a way to maybe look at that again. And again, I know broadband and all the technical part of it, but potentially kids that would be out quarantining, it may not, the numbers may not be that high potentially. However, if you had a whole team, yes. But I don't know, I really think that that might be something to really come back around and try to take another look at that. Just a thought.
So I guess that might be something we'll add it to the list and definitely explore, but that is something that would be subject to impact bargaining as well, based on contractual agreements, pre-pandemic, as part of the pandemic, and those different pieces. That is something that we could explore, but beyond the technical pieces, there are some contractual, not challenges, but contractual constraints that we would need to explore.
Totally understand. And I think if it was at least the high school level, those students, and I know we talked about quality over, quantity with, for the teachers and the class, but at least on the high school level, at least I think maturity wise, potentially they wouldn't be a distraction per se, but I just think it's really important for those students to be able to continue with some live instruction on that level. Because the high schoolers, I mean, and like all students, they feed off of the live instruction, and I'm seeing it here at home when my son's home 2 days a week and he's doing his work, but it's not necessarily, or it wasn't before, but the schedule changed. But just wanted to again talk about that. So thank you. The new teachers that will be teaching the 2nd and 3rd grade, and they're working with the other grade, their cohort, 2nd and 3rd grade teachers. So they would be working together to, discuss their lesson plans or the curriculum, or bounce off each other, correct? I mean, that's how they do it now. So that would be a continuation of that, correct?
Yes. And that's Wednesday afternoons, they have that planning time, and that's the time where they work together to really fine tune the lessons that they're going to deliver. So, and also we have our math coaches available to help out, and with changeover to the maybe some time for the literacy coach to be able to help with the content.
Yeah, and like you spoke, I think, Keith, about some of the staff that are taking on these roles. They've been within the school for a period of time, and know the students, and know the curriculum, and know the teachers, and again, we're not putting someone in a position that we don't think could handle this. Correct?
Correct. Yes.
And just to the schedule on the hybrid live learning, the addition of the 2.75 hours for grades 4 and 5. So they have different, so 4 has 1 hour of math, 1 hour of ELA, 30 minutes of science, and a 15-minute check-in. Grade 5 has the 1 hour of math, 1 hour of science, 30 minutes of reading, 15-minute check-in. On their regular, is this is in addition to what they're already getting that day?
Nope, that is their day. That when you add it up, that's to 2.75 hours.
So can you just explain why there's like ELA for an hour for 4 and science for an hour for 5? Is that based upon MCAS testing?
Yeah, that is, it would be an MCAS. Yeah, just an MCAS here. So we thought that the hour of science, and also it's based on the availability of the teachers that are able to teach. And so if they have that expertise in science, or that they're able to do that as well. But it is because it's a 5th grade year now, in school, they're getting some of that time as well.
And then, so the 30 minutes of reading for grade 5, that's silent reading, or is that reading with?
No, it's reading workshop. Reading
Okay.
workshop time. So yes.
All right. Just wanted to make sure of that.
Yeah. Reading instruction.
So
and
yeah, go ahead.
I was going to say there's reading in the content areas too. So in science, there's some nonfiction reading that happens. So reading happens across, not just fiction books, but nonfiction as well.
And then just 1 or 2 more questions was, if the CDC, and this is just hypothetical, if in their recommendation, when it comes out of, make potential changes, and if those potential changes were spacing, reducing the 6 feet. Where, as a district, where do we go after that recommendation? Do we have to wait for the state to then say that? Do we take that recommendation as a committee from the CDC? And then like, how would we move forward with that? Hypothetically.
So hypothetically, and from, I would say more from our past experience also, for example, when CDC changed contact tracing, the state Department of Public Health would then review that, and then we would make the changes at the district level. So it does go from federal to state to the local piece of it. So all three distinct levels having a piece in that. So that really would be the first step, and then continuing to work with our school committee, working with schedules, working with the state. There are a number of factors to pull it all together.
I think that's all I have at the moment, Dave. Thank you. Thank you, everyone.
Great. Thanks, Mary Beth. Arthur?
Really just a few follow-up questions, a couple of comments too. On that last point that Mary Beth raised, isn't the state already saying 3 feet's fine?
The state has the piece of 6 feet when feasible, but you could go down to 3 feet. Yes.
All right. So.
And that would be from DESE, and the CDC pieces for contact tracing have come through the Department of Public Health.
Okay. Going back, just so that I understand it on this issue of the kids that are quarantining, is it just a resource issue? Is that what it is? That we can't do more for them?
It's a resource issue, but I think Keith also shared the pieces of past contracts that we've had with our Teachers Association and looking at the use of technology for beaming into a classroom.
Same thing about live streaming that we've been having this whole.
Yes.
Yeah, the same discussion. Okay. Just so I can kind of drill down to with this change, how many, so Keith, you can probably answer this. When we implement this program on 2 weeks from now, assuming that we vote for it, will all the teachers that are teaching, will they be licensed at that time?
Yes, we anticipate by that time they will all be licensed.
Okay. And are any of them that will be teaching not licensed now?
That they're in the process of applying for their license. Yeah, so some of them are not licensed at this moment.
And how many?
I believe, working with Janet in my office, 2 of them. I'm looking for Lisa and Mary for confirmation of that.
I think so.
Okay.
And we could get back to you with that directly, where I think I actually have to fix one of the slides that we showed this evening also between the 2 and the 3 schools. We did have one school adjust their plan. So I think we would just want to do a double check on that last school that changed, and we'll be having a teacher aide become the teacher in the classroom.
All right,
and again, we're looking to fully support them. So that in some cases, as the teacher's working on their licensure currently, the aide that's going to be in the classroom is a licensed teacher, and working with how we balance all of those resources to support students.
Right. So I think I'm just trying to narrow down the issue. And so really we're only talking about 2 teachers that we do expect to be licensed when this goes into effect. But even if they weren't, I think I'm hearing that you'd be completely confident in their ability to run the classroom at this time, correct?
Yes.
Yes.
Okay. I think that, Keith, you may have alluded to this already, but the staff, the staff at the teachers at the elementary schools, they're on board with this. They're okay with what we're doing here.
I would say they're understandably apprehensive, right, of bringing back more students into their classrooms, but keeping the 6 feet of space. I would say yes, they are on board, and we hear their health and safety concerns as we've heard this whole year, and working with them around what PPE and what items that they need for their classrooms. And we encourage them to continue to reach out to us with what those items are and what they may need to feel safer, to mitigate more of that risk. But yes, I would say they are on board.
All right, and just again, just trying to kind of expand upon what I heard you saying. And again, if I'm expanding improperly, let me know. But it sounds like they had a lot of input into how this was all going to be kind of laid out, correct?
Yes, we learned from our past experience when we did the last one, where they weren't brought into the process until later, so they were included early on in the planning process.
Okay. And is there any negative effect at all that you can see for the 4th and 5th graders? Are they going to, is the situation going to get any worse because of what we're doing?
No, I think it's really provided them an opportunity to have more consistent time with their actual classroom teacher. So it's benefited them because there's less of the hybrid remote support needed. So their teachers and everybody gets to spend more time with their direct cohort as a whole.
Okay. All right. That said, I think most of the questions have already been asked. I mean, I think it's a good idea to, as I've said from the beginning, we want to get more kids back in when we can, and as soon as we can, whenever it's safe to do so. So I think that I'm going to be in favor of this proposal. Thanks.
I just had one quick question, Keith. To get licensed, though, as a teacher, you do need to have a college degree, correct?
Yes, even for their emergency licensure, yes, there are minimum requirements.
Okay, great. Thank you.
Great. Thank you, everyone. I just have a 2 or 3 quick questions. Most of my questions were answered. One is just a little clarification on kind of why not Wednesday. You mentioned this a little bit, Dr. Dana, and I think just a little more clarity around that. I heard you say, let's do the 4 days, make sure it works first, so we don't, have a situation and then, have to backtrack and then continue to reevaluate it. But could you just talk a little bit about some of that rationale?
Sure, and I'd ask Keith to add the details. So cleaning is part of when we talk about hand washing and hand sanitizing. Cleaning is also part of the mitigation strategies. So looking at the cleaning, and we've put a schedule. So Keith, would you describe in more detail that the deeper cleaning and the way that, because we do have Wednesdays and then the weekends?
So on a nightly basis, the custodian and SJ Services, who's the contractor, cleans all high kind of touch high frequently. So light switches, doorknobs, bathrooms, and they're able to clean those types of items as they would during a given year and in more depth. But then on Tuesday nights and Wednesday, and then on Friday nights and Saturday mornings, they do a much more deeper cleaning of the entire building. So they wipe down every single individual student desk. They wipe down every student chair, legs of tables, items that are in the rooms, teacher desks, windowsills, and really do a deep clean. So even without the mixing of the cohorts, we think it's important to maintain that deep cleaning with the ongoing pandemic. So if we were not to have that Wednesday element, they wouldn't be able to do that deep clean because there wouldn't be enough manpower to be able to do that in any one given night. It includes like library or cafeterias, all of those spaces. So those shared common spaces also get a deeper cleaning twice a week.
Okay, great. Yeah, I just wanted a little more clarity on that, with the idea being that we could always potentially move to Wednesdays down the line, which is the ultimate goal, to get everyone back in 5 days a week. As again, provided everything is safe. I just wanted to make a comment on the live streaming, and especially related to the quarantine students. And I guess this is to my colleagues that are on the negotiation committee. I think that's really important to be able to allow quarantine students to be able to live stream in, and potentially other students as well. So I'll just throw that at you. And I'm talking more at the high school level. I don't really see the need for it at the lower levels, but I just wanted to mention that. And then Keith, just a question, last question here on a little more explanation about the BINEX testing that you mentioned. Like how and when will that be implemented? Is that for teachers and staff? Is it for kids? Is it for both?
So it is for both. So it's for teachers and students. There are prerequisite consent forms that need to be complete. So we encourage families to complete those. Those were sent out a few weeks back. We could probably ask the principals to include them again in their Friday updates, but it is for individuals that are experiencing and displaying symptoms. It's only if you're in the school setting. So if you develop symptoms at home, we don't want you to come in to get this test. If you are sick, you need to stay home and not just come in for the test availability. But if you were to develop symptoms during the day, the nurse has the ability to give you this test based on their capacity any given day and their workload. And it is a rapid test, but it is fairly accurate for cases with high viral loads. So if you test positive on this test, you are considered a positive case and contact tracing begins immediately. If you are to test negative, you will still be required to get a PCR test, which is that molecular test. The molecular tests are able to identify lower viral loads. So we still look for you to get that test done in order to be part of your clearance to return. So again, it's for individuals who display symptoms in the school setting, but those should only be symptoms that develop once you're at school. Please stay home if you're not feeling well. That's one of our main mitigation strategies to make sure we're keeping everybody safe.
Right. And so the message there is to get parents especially to get those forms signed and get back to the school in order to be able to implement this program.
Yes, please.
Okay, great. That was it because everyone asked all of my other questions. Any other questions before we appropriately go to take a vote? No. Okay, great. So we have a motion, we have a second, which is to bring the second and third graders back to school 4 days a week, starting right after February vacation, Monday, the 22nd. So now, Diane, if we could do a roll call, that'd be great.
We will. Eric Crane,
Yes.
Jeff Kay,
Yes.
Arthur Scamus,
Yes.
Mary Beth Ferry,
Yes.
and Dave Thompson.
Yes. So the motion passes. Great. Thank you for that presentation. We're going to move on now to school committee discussion regarding community feedback. And I have the bulk of this, at least at the beginning here. So I'm going to get started at this. Just before our last meeting, we had a request from a parent who had started a petition, to get all of the students back in person full time. The request came in just before our meeting. It was too late to get it on the calendar legally. So we told them we would discuss it at tonight's meeting. Since that meeting, Dr. Dana and I had a call with this parent along with two others to try and get a better understanding of their concerns. So as a result of that, this parent provided 4 points that he requested be part of tonight's meeting. So we decided to put it here as opposed to at the beginning of the meeting under items of interest from the community, because we thought it felt better coming after the recommendation from the administration on the second and third graders. So I'm going to go through each of the 4 requests and provide a response, some of which we sought the advice of legal counsel to provide an answer. The first one is more transparency with the negotiations between the subcommittee and the union. As a background, the 3 parents who spoke to asked for a liaison to be allowed to be in the negotiation sessions between the school committee and the teachers union. We explained this wasn't possible because there was really no fair way to determine who that person would be without an election. So therefore, part 1 of his request reads, during our call, you mentioned that 1 liaison was not legally allowed, but that with permission of the school committee and the union, we could pursue attendance by the general public to view these negotiations meetings the school subcommittee and the union via Zoom or in person when public meetings are once again allowed. Again, we recognize many aspects of closed door meetings, teacher compensation, et cetera, are not of our concern. So we just ask that attendance to the public be open for only the components of these negotiations that pertain to returning the children to in-school learning. This is not an unreasonable request, and it would speak volumes if the union does not agree to it. So our advice of our legal counsel, or on advice of our legal counsel, we've decided that it's in the best interest of the district overall to maintain the same policy as we've had in the past to conduct negotiations with only members of each negotiating team present. And we respectfully decline the request to propose public negotiation sessions and did not propose, public negotiation sessions to the DTA. The school committee is elected to serve and make decisions that are in the best interest of the district and all of the people affected by those decisions. You have a voice at the table because when you bring your concerns, ideas, and input to us, we take that into consideration as we formulate negotiating positions. In the current circumstances, we are all in this together in the need to balance the in-person learning and time to keep members of our school community safe. We're confident that our negotiations will strike the proper balance of these important interests. We will not be a party to pitting one group against another. As mentioned in a previous meeting, or perhaps it was in the community forum, not all 5 members of the school committee are involved in negotiations. We designate 2 members of the committee to the negotiating subcommittee. Currently, these 2 members are Arthur Scommers and Eric Crane. They provide us with regular updates on the status of negotiations, and we are confident that they're representing your interests and are doing everything in their power to continue deliberations and bring them to conclusion as quickly as possible as they follow the established process. So that was part 1. Part 2 is we would also like the dates of the subcommittee and union rep meetings to be publicly announced. The notion that these happen continuously or month by month is not sufficiently transparent. All dates of the subcommittee meetings are published in advance of the meeting. It has come to our attention that a couple of the recent negotiation dates were not published in advance, and that was simply an administrative error. All meetings will be posted going forward. As an aside, there have been no policy meetings in recent months, so there have been no postings for those meetings. Number 2, they would like a detailed plan of the parameters to bring children back. Again, we're not asking for what date this would occur, but rather what the conditions would need to have in order to be back. When this was repeatedly mentioned in the school forum, the canned response was that was the magic question and was not able to be answered because many factors exist. It seems that 6 feet distancing limitations and staffing issues between in-person and remote learners should be the only 2 factors preventing the kids from returning, and anything outside of this, frankly, just noise. If both are solved, please let us know what other factors would exist that would preclude us from moving forward with an in-person learning. So the answer here is we appreciate all ideas and suggestions. Dr. Dana covered most of this during her presentation. Our plan is to have grades 2 and 3 join grades K and 1 and returning to school 4 days a week starting Monday, February 22nd. The modifications to schedules for all grades were presented. And at this time, with our commitment to adhering to the 6-foot guidance of the CDC, we do not have a plan to bring additional grades back in person at this time. However, this will be constantly reevaluated, and should things change, such as enough teachers are vaccinated, the virus numbers are decreased to acceptable limits, which allow us to renegotiate distancing with the unions, and or state mandate that we return to in-person learning full time. Once those happen, we'll make the appropriate adjustments. There are just many factors involved, and we just simply can't be definitive on this answer. Number 3, survey to parents and teachers asking pointedly in separate surveys if these 2 groups would be comfortable moving to in-person learning at distance levels below the current 6 feet. As an example, DESE suggests a minimum of 3 feet. The survey may be caveated in a number of different ways, examples being teachers still remain at 6 feet, lunch remains at 6 feet distance, students continue to wear masks throughout the day, etc. Ultimately, we want to be sure these surveys are specific enough that we are truly able to capture the necessary data points. The survey is absolutely crucial for gaining a baseline understanding of where families, teachers, and staff stand on the distancing issue prior to negotiations with the union to update the memo of understanding. It appears that Danvers can achieve a minimum 4-foot spacing in every classroom district-wide per the July feasibility study. The response to this is that the administration considered this request, but the concern is that even if the results come back overwhelmingly that parents want children back in school at less than the current 6-foot distance parameter, we are concerned that the results might not be actionable right now, and that by taking the survey and receiving the results, we are setting expectations that we may not currently be able to meet in a reasonably safe manner. As discussed, there are other conditions to weigh besides physical distancing, and we will be prepared to conduct a survey in appropriate time. And the last one, number 4, relative to the vaccine, we'd also request transparency as it relates to coordination efforts. Perhaps if this isn't already the plan, the Department of Public Health should host a vaccination clinic for teachers and staff prior to the K-12 educators receiving the eligibility green light for vaccination. This will streamline the process significantly. We cannot afford to be reactive any longer. In other words, if we have to wait until teachers have a green light to vaccinate before we have the plan, we will have lost precious time if we haven't already had something like this clinic/forum. Perhaps we could aim to have a tentative plan in place for the mechanics of a plan by March 3rd. This would allow the department, the Danvers Public Schools, a 6-week heads up for returning to in-person learning from the receipt of first dosing, assuming unions agree to the reduced spacing with the stipulation of vaccinated teachers. These dates are used only as suggestions to consider. We are aware that depending upon the vaccine, when the vaccine is given, the second dose is given 21 to 28 days later, and then another 2 weeks for full efficacy. So this was discussed in our workshop tonight, and Keith also touched on it in his presentation, but Danvers Public Schools, like all schools throughout the Commonwealth, have absolutely no control over when and how the vaccinations are distributed. Based on the latest information from the state, teachers are slated to be eligible for vaccination in phase 2, group 3. Based on the current vaccine availability, the state is currently in phase 2, group 1, which opened on February 1st and is for individuals 75 years and older. Phase 2, group 2 is next, and that covers individuals 65 years old and older, and individuals with 2 or more certain medical conditions, and or residents and staff of low income and affordable senior housing. Phase 2, group 3 is next. The overall dates of phase 2 are February and March. We don't know yet and don't know when when phase 2, group 3 will begin. Once it does begin, we don't know where or when teachers are able to get the vaccine. The district has offered to be a vaccination site, but have not heard anything from the state. Once the teachers start to get vaccinated, we expect it will take several weeks to get the first vaccine for the majority of Danvers teachers. They will then have to wait 2 to 4 weeks for the second dose, and then there is the additional 2-week period for full efficacy. So unfortunately, there's no way for us to get the state to prioritize Danvers teachers over teachers in other cities and or towns in the state. In fact, the state may decide to prioritize teachers in higher risk communities first. We simply don't know, and unfortunately don't have any control over this situation. So those were those 4 points. And before I open it up to the committee to discuss, I just wanted to give one example to kind of show the other side of things. And this is just an email from an elementary parent saying, I want more than anything for my son to be able to go back to school in person full time, but I also feel very strongly that the safety precautions need to be maintained and that the demands of other parents who don't see that should not be the cause for my child to go back in person to an in-person learning environment that I don't feel comfortable with. She goes on to talk about the importance of maintaining the 6-foot distance based on the CDC guidance that we've been following. So I just wanted to mention that other voice is out there because as we've all mentioned, we've received countless emails ranging and, from every aspect of the spectrum on this. But as promised, wanted to mention that and open it for discussion. Jeff, anything you'd like to add?
No, I mean, I think you answered it pretty well. I mean, it was a good sort of summary of the types of questions we've been getting, right? It's not easy, and we do consider all those, and that's kind of why I mentioned some of the things earlier, which is, and those are just 4, right? There are other things that come up as well you know, when you move one side of this, another thing sort of shifts. So, I mean, we appreciate the comments. We do read them. You know, we're moving as fast as we can. And the other thing I'll say, we appreciate the recommendations, right? When people come with constructive comments and say, well, why can't you do this? Well, why can't you do this? I think, and I mean, correct me if I'm wrong, with the frequently asked questions and everything that we post, we do address why we can or can't do some of these things, right? We do say, you know, yes, we you know, could go 6 feet, or we can't do 3 feet, or if we go do 3 feet, well, we can't do X, Y, and Z, right? So we're trying to be transparent in that. So I think what we've got is fair. Is it the best? Probably not. Are there other solutions? I think we've tried to address, hopefully. But if we're not answering a specific question, let us know. And this is what this forum is and what we're trying to do now. So nothing else to sort of comment on that. So thanks for reading that, Dave.
Arthur.
Yeah, just a few additions, I think. And yes, lots of emails and lots of discussions with people. And there are a lot of people that want their kids back in school full time now. There are people that want their kids back full time at some time soon. There are some families that have told me that they want to keep the 6 feet and they're okay with how it's going now. And you know, there were times when the teachers that wanted to go full remote, and that, you know, so it's all kinds of different voices coming from all different angles. And I don't blame anybody for what their position is on this, because everybody's coming from, I think, a position of what they believe is important. Obviously, parents want their kids educated. They want them safe. Teachers want to stay safe. I mean, everybody's doing what they believe is right for them. I will say it's difficult to, Dave, you alluded to this, but it's difficult to be specific about timing. I mean, if you ask me what is most likely to get us back close to full time, or 4 days, or whatever it might be, is if the CDC changes their guidance and reduces the space. And I think that's a reasonable possibility, since a lot of the science currently says that the masks are far more important than the distance. And so if everybody stays masked up and the CDC says it's 3 feet or 4 feet, then I think that I would be certainly inclined to follow that. Also, it's getting the teachers and the 65 plus group vaccinated. And that, I think, is going to happen relatively soon. I think that as this vaccine, you know, we, just like with the testing last year, you know, a lot of hiccups when it began, and then it started rolling, and you know, you could get a test anytime that you wanted to get a test. And I think that's going to happen with the vaccine. I think the federal government is trying to push vaccines out, get them to the states. I think our state is, and I think Mark Carleo of the Board of Health said to us earlier that the state is really kind of on the cusp of having a robust vaccination program that they'll be ready at some time in the near future. So I don't think it's unreasonable that you know, and we don't know, but that it's unreasonable in the next 5-6 weeks that teachers will have had the chance to be vaccinated, maybe 2 months, whatever it is. And the over 65, because people are certainly concerned about bringing it home. If they have older people in the house, will be vaccinated. Doesn't mean that everybody has to get vaccinated. If somebody chooses not to get vaccinated, but they have the opportunity to get vaccinated, then I think that we would want to get our schools opened up. Now, when is that actually going to happen? We don't know, but I think it's trending in the right direction. And, you know, when that does happen, when the teachers are vaccinated, the 65 plus are vaccinated or have had the opportunity to, and again, what the CDC does will make a difference. You know, we could be looking at something in the, you know, towards the end of this school year. I don't know, but I mean, that's certainly possible. But we don't know, because we also don't know what the virus is going to do. We don't know if the variants are going to change. We don't know if the numbers are going to go up. Everything right now is heading in the right direction. The numbers are heading in the right direction. The vaccine's getting out there. There's a push from, I think, the new administration to get us back in school. So I think we're looking to get there as soon as we can. But it's difficult to, as Dave pointed out very clearly, it's difficult to put a timetable on it. So, but those are the things that I'm looking at as far as when we can get back in. Thanks.
Great, thanks, Arthur. Mary Beth?
I just want to thank everyone that participated in the forum. I want to thank everyone that continues to send us emails and advocating for your child, because as a parent, that's what you do. And as a committee, we're doing our best to try to get everyone back into school. I mean, it is a priority. It's just we have to be conscious of the health and safety of everyone. And that is students, that is families, that's the staff, it's the community as well. So we will continue to do our best that we can. So that's it. Thank you.
Thanks, Mary Beth. Eric?
Thank you, Mr. Chairman. I'm pretty much on board with the things that Arthur said, and Mary Beth and Jeff. I do want to thank everybody who took the time to email us, everyone who took the time to attend the forum. And I have to say, you know, there is a wide range. I think the parents who want their kids back in school desperately, I feel that they should know that there are other parents who are very concerned about having the kids back in school too early. So you try and take in, if you're us, you try and take in every bit of information you can take in, and make the best decision that we can. So I do appreciate people who have given us feedback. Most people are in fact really polite about it. I did have, and I'm laughing about it because it was kind of funny, one of my family members overheard someone walking by point to my house and say, well, that's where the a-hole lives who won't let our kids back in school. So it's okay. I laughed about it because frankly, in 20 years, I have no doubt that I've been called worse things by better people. So it's fine. And that's kind of what we sign up for. But one group I want to talk about tonight that I don't think signed up for some of what they're receiving are the teachers. And we have received, among the feedback from the community, some feedback from groups of teachers at different schools who want to emphasize that they want to be back teaching. They're not experiencing this year as some sort of easy year. They're working in many cases hard to try and deliver, in fact, in every case, very hard trying to deliver education to different students differently in an ever-changing environment where we're sometimes changing and working with them to change what we're doing, the hours that they're teaching, all sorts of things. And teachers go into their profession because they want to do something for kids. It's almost a calling for the teachers I know, that they truly want to be in the classroom. They want to impact kids' lives. They would like nothing better than to be back together with their colleagues, working together for the students in this town. And yes, you know, Arthur will tell you, we have been on the negotiating subcommittee for a lot of years. And while we don't always agree on certain particulars during negotiations, and there are issues that have to be worked out, I don't think either he or I have had a serious doubt that the teachers are committed to what they're doing and really want to be there for our students. So for those who would say, try and fix blame and say, well, it's only because of the teachers union that we're not back. It's simply not true. It's because of the COVID virus that we're not back. It's because of a once in a lifetime event that has affected all of us in different ways, that has required the administration, teachers, school committee, parents, students, practically, in fact, definitely everybody, to react sort of on the fly to a lot of things and try and balance the need for sort of normalcy versus the need to keep everybody safe. And so I hope that we can, in general, in this town in particular, give each other a break in terms of what we're all trying to accomplish here and what we're all going through together. We have had tough times before in this town. We had a neighborhood that blew up. We lost a beloved teacher not too many years ago. And the way we got through those events was to pull together and support one another and at least assume the best about one another. So I hope that going forward, when it comes to teachers, parents, all of us, that we can take a time to assume that the other people we're dealing with have the best intentions and want what's right for their children, for their town, and for the students they teach. So that's really it. Everybody else has said anything else that would be important. Thank you, Mr. Chairman.
Thank you, Eric. And as usual, you, number one, stole my thunder, and number two, said it much more eloquently than I probably would have. But I think it's just really important to echo what Eric said and to remind people that the pandemic is the enemy. You know, the pandemic is why we are not in school full time. Parents want their kids in school full time. Teachers want to be in school full time. The administration and the school committee wants everyone to be in school full time. Everyone just has a different opinion of when and how that's going to happen. But keeping that in perspective, I think, is really important. We are all against the pandemic and for getting our kids in school. So I will end with that and move on to Fall 2 sports. Well, Lisa, you're on mute.
I apologize for that. Thank you. That will be the new terminology for this year also. For our Fall 2 sports, the superintendent recommends starting our Fall 2 sports per the MIAA.
So moved.
Second.
Okay, we have a motion and a second. Any discussion about Fall 2 sports?
Any information to share on the dates or how things are going, Lisa? Or
Thank you. I would ask Keith for the sort of the timetable and that it's really looking at outside activities.
So starting late February, kind of squeezed in there before the traditional spring season. Mostly outdoor, some indoor sports. This is kind of that hodgepodge. Volleyball, I believe, is inside. Track is going to maybe practice some inside, but run meets outside. So some traditional indoor sports with outdoor components, but primarily outdoor. Football is the big one. They've listed the modifications this week, or football involves not the biggest sport, involves the most students from some of our sports, marching band. So kind of that sphere. So working with them, but with the numbers coming down and the mitigation strategies and the dedication of our student athletes, we're comfortable moving forward kind of in that outlined season. And we are exploring, just to answer the community's question before, what options we have to plow the turf field if necessary. So we're out there looking. There's some companies that have started to do that. So Andy and I have had conversations with Travis and the grounds department about what that could look like.
It'd be a good workout drill for the football players.
That's, you know, just run different lines, straight back and forth.
With a shovel. Any other questions on this? Great. Diane, can we do a roll call vote, please?
We can. Dave Thompson,
Yes.
Eric Crane,
yes.
Jeff Kay,
Yes.
Arthur Scamus,
Yes.
Mary Beth Berry.
Yes.
Great. The motion for Fall 2 sports passes. And we will move on to homeschool proposals.
Thank you. We have a couple other items for new business. For our homeschools, the superintendent recommends the approval of the notice of intent for the homeschool proposals that are included in your packet for the remainder of this school year.
So moved.
Second.
Okay, we have a motion and a second on the homeschool proposals. Any discussion? Hearing none. Diane, can we do another call?
Dave Thompson,
Yes.
Eric Crane,
Yes.
Jeff Kay,
Yes.
Arthur Scamus,
Yes.
Mary Beth Berry.
Yes.
Okay, the homeschools pass. So we'll
Thank
move
you.
on. Go ahead.
Thank you. Our fundraising request, the superintendent recommends the approval of the fundraising events that have been submitted through February 8th, 2021.
So moved.
Second.
Okay, we have a motion and a second. Any discussion on the fundraising requests? Hearing none. Diane, you are up again.
Dave Thompson,
Yes.
Eric Crane,
Yes.
Jeff Kay,
Yes.
Arthur Scamus,
Yes.
Mary Beth Berry.
Yes.
Thank you. And then one last item, our overnight out-of-state field trip request. The superintendent recommends the approval of the overnight out-of-state field trip request from Danvers High School to the Galapagos Islands, April 16th through the 22nd, 2022. And this has been a rescheduled trip from April of 2020.
So moved.
Second.
Okay, we have a motion and a second. Any discussion on the out-of-state field trip? Obviously, it's pending, COVID and all of that. So that
Yes.
goes without saying these days. Diane, can we do a roll call, please?
Dave Thompson,
Yes.
Eric Crane,
Yes.
Jeff Kay,
Yes.
Arthur Scamus,
Yes.
Mary Beth Ferry.
Yes.
The motion is approved.
Mr. Chairman, before we move on to unfinished business, I'm sorry, but the public hearing on the budget, might we have a 5-minute break?
I was just going to ask if people wanted that. Yeah, so we'll do a 5-minute break. We'll come back and we'll close out of this and start our budget hearing. So we'll see everyone at about 8:50. to suspend the school committee meeting to go into our public hearing.
So moved.
Second.
Thank you. We have a motion and a second. Any discussion? Great. Diane, could you do a roll call, please?
Dave Thompson,
Yes.
Eric Crane,
Yes.
Jeff Kay,
Yes.
Arthur Scamus,
Yes.
Mary Beth Ferry.
Yes.
Great. And I'll just mention to participate in the budget hearing, to discuss the budget. Participants can join using the webinar link that is on the agenda.
Thank you. And to clarify the format, the superintendent's presentation. So Keith and I will make a presentation in just one moment. And usually after that in the hearing, the chair would take feedback and questions from the committee members and then open it up to the public. So using the technology at that time when Mr. Thompson opens it up to the public for comments on our budget, Mary will be looking for anyone within the webinar, and then she'll bring in one person at a time to give their questions.
Perfect.
Thank you. Okay, so I think, Mary, we're ready. If you would please pull up the presentation for us. Okay, and as Mary's doing that, would like to begin with how grateful I am for the collaboration and the teamwork that brings our budget together on a yearly basis, and to Keith Taverner for leading this work with our district as our assistant superintendent, overseeing budget as one of his major responsibilities. So in the collaboration that we have with the town also, and we'll talk about that throughout the process also, that gets us through this day, that we are one town, it's one budget, and working at looking at all of the revenue together and all of the needs of the district and the town when we put together our annual budget. I just want to check in with Mary, how we're doing with.
I don't have the presentation, but you could, if somebody else has it up, it's not on the agenda. I don't think.
It is.
It is.
Oh,
I
because we have the entire budget. Give us
PDF.
just 1 second.
If you share it with me, or you can present it yourself. I open up the meeting.
Keith, do you have it as a separate, other than the budget presentation? It will just take us one moment.
So Mary, I just shared a new link.
Okay, thanks. Yep, I get it. Thanks. Sorry about that.
That's okay, that we had linked the entire budget and missed the piece of the separate link. Here we go. Again, thankful for the team of the resources in pulling this together. Thank you. So for this evening, our FY22 budget presentation, we'll begin with an overview, and the format is very similar to in past years, and we then put it together for the needs of every year's budget. So it's an annual process. We build the budget based on our priorities of our strategic plan. That includes reviewing all of our programs and accounts with our administrative team, who works with our teachers in the community, Keith and I working with the town. So there's a review of our FY21, where we've been looking at identify needs for FY22, being able to look at the finances and the percent over historical perspective. And then we'll finish with our budget proposal and open that up for questions and discussions from our school committee members and then from our community, as this is a budget hearing. The timing of our budget process for Danvers, we begin in the December timeframe through now February, which is where we begin with a budget hearing. The school committee will then vote at their public meeting in March. So we really give the time between February and March from the work that we have done with our administrative team, with the town budget team, for then the community and our school committee to have it for about a month before the school committee takes a final vote. During that time, the town budget will also be moved forward as of March 1st to the Board of Selectmen. And at that time, I believe we're looking at March 13th for the Board of Selectmen to review the town's budget. In April is when our FinCom, the Finance Committee, will have public hearings, which leads us to May 17th for the annual town meeting. We begin the fiscal year July 1st, and then again, school starts in September on a yearly basis, so September through June of implementing this budget that we're speaking about this evening. All of our work centers around our strategic plan. So when we look at the budget, we continue, and this is always our starting point. So our mission and our core values. Our mission, Dave, here it is. We didn't have it earlier, and here it is at this part of the meeting. You're welcome. The Danvers Public Schools is a dynamic community of independent learners dedicated to respect, responsibility, creativity, and the pursuit of academic and personal excellence. With that, our core values of caring, quality, commitment, and collaboration. This year, we have moved forward with really digging deeper into our caring core value with courageous caring as we continue to look at equity, especially racial equity during this year, and a long-term commitment to this very important work going forward. From our strategic plan, we then move into the vision. So we look at 5-year increments. The pandemic has definitely challenged us this year, which we continue to have our priorities, and we will regroup as we continue to look at the next year based on the work that we were able to do with our students this year. So in 2023, we want to be an inclusive community of learners. Each year, we continue to make strides to strengthen being an inclusive community of learners. Have a welcoming environment for our students and families, which is evident, and that diversity is valued and celebrated. We want all of our students to be fully engaged and invested in their learning. Again, we understand that this year with the pandemic has again challenged the engagement of our students. So we continue and we'll reassess, and we'll talk about the cycle of strategic planning also in this overview. And really, when we look at the skills and when our students leave the Danvers Public Schools, that they will be skilled communicators, problem solvers, engaged in collaborative inquiry, making effective use of technology, and applying their learning in authentic real life situations. So I think this year we will have many examples of lessons learned that we would maybe not have had in other given years. From there, when we look at the building the budget, as we've spoken about educating during the pandemic, these are our 3 priorities: to have a safe and supportive learning environment. We have coherent curriculum instruction and engaged students. And we talk about that as in all of our decisions academically, looking at social emotional learning, and looking at procedures and policies within our district. So that includes the budget this evening. As I stated a moment ago, the strategic planning cycle, which we do with the budget also, it's around evaluations, and we look at professional development and putting a strategic plan together. So we begin with a self-assessment, we analyze, we set goals, we put a plan together, then we implement the plan. We have mid-cycle goals and reviews, and we do summative evaluation. So the same thing throughout the budget process, that we have an assessment, we put our goals together for our budget, we will be implementing it September through June. In between time, we have our check-in cycles, check-in reviews during the school year with our budget, and then we have an end of the year, we pull it all together as a summit evaluation of how we did with any given year's budget. So at this time, I'm going to ask Keith to continue with looking at the finances of our school in the school district.
So each year we begin by looking at our townwide challenges and assumptions. I will say that this is kind of our base budget for operations looking at next year. Most likely we'll have other needs that we'll be looking at using our ESSER funding for the state federal money, as well as potentially some more challenges even as we move through the budget process looking to present a balanced budget to the town on March 1st. I would anticipate that we'll most likely come back to you with some reductions to what this proposal is, but at this point, based on what we know, we have another meeting tomorrow. I'm confident that it will not be a reduction in staffing, but looking at some alternative revenue sources to help with FY22 in order to keep this base. What we're going to present to you, really, that's the focus on, is with all of the unknowns going on, how do we keep that strong base that we have so that we're not eroding into that and that we can quickly come out the other side in future years. So starting, obviously, we have the challenges from the ongoing global pandemic. As Rodney Conley, the town finance director, presented at the financial summit, we do have reduced local receipts and revenues to the tune of around $1 million. So hotels currently is down about 630,000, meals is down 300,000, and licensing and permitting is down about 150,000. So these are obviously significant challenges when it comes to balancing the overall town budget looking into FY22. We have our unknown state aid. The governor recently released his first potential look at what aid would look like. It still needs to go through the House, the Senate, and then joint committee. For Danvers, that was 1.4% in Chapter 70, or $30 per pupil, for about $101,000. Since then, they have come out that tax collections during the month of January well exceeded expectations. So there is some hope that maybe those projections could go up as it works through the budget process. We do know now a little bit more than when we created this presentation about our stimulus money. We do know the amount for our ESSER 2 grant, but there is talk at the federal level again about whether more resources are needed to help schools continue to reopen and stay open. We then have the new costs of the ongoing testing, PPE, cleaning, etc. Those costs are not going to be baked into our FY22 base requests, and those would be costs that we'll continue to take out of our ESSER stimulus funding. This budget is built on the assumption of full in-person learning model for September of 2021. Obviously, that remains somewhat in flux, but with the vaccination on the horizon, we are hopeful that when we come back that it may not look exactly how it did in the beginning of 2019, but that we will have all of our students with us in person every day. Looking at retirement funding, again, as part of the financial summit, we talk about this each year and the retirement actuarial valuation and what that funding schedule looks like. So for the town-wide budget, that is a significant increase each year to be in, to have that funding schedule fully met per GASB and the other recommendations as we move into the future. We continue to monitor our health insurance. That historically has been a significant increase over the last 10 years or so. As you might remember, last year we restructured those plans. So those costs are a little bit more under control for this upcoming year, but we're still waiting to finalize those numbers as we move forward. We continue to monitor our special education out of district tuitions. We'll talk about that in the coming slides, but if you remember last year, we had 10 students move into the district, which caused a significant financial challenge, and we talked about a 2-year plan to help bridge that gap. And then other post-employment benefits, OPEB, and shifting that from a warrant article and from free cash into our tax levy. Again, as we look about making that base sustainable and not creating holes that we just need to fix in future years. We do look at an assessment of each program and an account on a yearly basis. We look at our student needs and staffing. This year, we'll talk a little bit about the elementary level. We look at enrollments. We look at our special education, again, the tuition in that 2-year plan that we'll talk about in the coming slides. We look at our contractual obligations and then continue to focus on our priorities of our strategic plan, which Dr. Dana reviewed earlier around student engagement and social emotional learning, looking to preserve the solid foundation that we have and focusing on our programmatic needs, and then what other supplemental needs that we might have. As we look at our contractual obligations, you'll see that our 3 largest unions here are teachers, our aides, and our administrative assistants. We also have a cafeteria workers union, but they are funded out of an enterprise account, so we don't typically talk about them here. But all 4 of our unions are up for negotiations this year, so we do not have any agreements at the time being. We'll be starting that process actually this week with some of the unions and looking to move forward with our teachers union in the coming months. We also look at our non-union staff and the cost of living adjustments that they may get based on evaluations, and then our unions have both steps and that cost of living adjustment in their contracts. So again, as we look at our programmatic needs and our resource allocation based on student needs, we just talked about our contractual obligations on the personnel front with union negotiations. And then we also look at transportation and the large yellow school buses that we have and what that contract may have for increases, which for this year, thankfully, is actually tied to the Consumer Price Index industrial. And that has just a moderate increase this year. We do look at our enrollments on a yearly basis. We continue to talk about our forecasted growth at the elementary level. Smith School will have an additional third grade teacher in this coming year as that larger cohort moves through the system. Great Oak, just based on class sizes, will actually see a reduction of a 1.0 teacher in grade 1. With the pandemic, we did see a decrease in the number of kindergarten students which enrolled in the district this year. It was ended up being an average class size for us. So it was in the 260 range. We did forecast to see an increase, but if we look at private school enrollments and we look at homeschooling and deferrals, we are anticipating an extra spike coming up for the kindergartners that will be enrolling this year, which we just had our base registration in January. Those numbers are up, and then we're waiting to see if we have students look to re-enroll in the district for first grade as we return to an in-person learning model. Based on changing student needs, there is a proposal of a 1.0 additional teacher aide for the Highland School. This is our only increase in staffing this year in our budget. Again, this is a very basic budget to make sure that we fund our needs, but when we look at the overall financial picture, there's not a lot of resources to add other programs at this time. We continue to look at our student engagement and our other needs. So our elementary science textbooks. I know we've had some conversations about what science looks like, but again, when we return in person, we are excited to have a state-of-the-art science curriculum that will really have students hands-on. So you'll see an increase in the cost for that. And then an increased cost based on the operational services division sets an inflation rate for all out-of-district tuitions. So that increase is seen in the budget, as well as other program reconstruction. So as we talked about last year, the town was able to provide a $600,000, almost $700,000 cash infusion to help our budget and to help offset that cost of the tuition increase of the 10 students moving in. This year, based on those 10 students that started mid-year last year and House Circuit Breaker, which is a state reimbursement that comes in based on tuitions paid over $40,000. We have excess revenue that we're receiving this year that we did not expect. So we're going to use $167,000 of that excess revenue coming in FY21 to offset FY22. This was part of our plan to use that circuit breaker reserve account that we have. We can carry money over 2 years to help offset the FY22 budget to help bridge that gap over 2 years. Each year, we really review all of our accounts. We look at all of our line items. We look at our personnel structures. We assess non-salary and textbook curriculum resources. We kind of start from zero in all of those accounts. So just because you got money last year doesn't mean you need money next year. We assess all of our transportation needs and contracts. We factor our known retirements into the budget. We review all of our fees and continue to look for grants to help bring in those innovative different programs. We also continue to monitor possible impacts to the budget, both for this year and for next year, but looking at the status of the ongoing global pandemic and what those implications are, looking at enrollments, especially around preschool and special education, looking at our tuition out budget, any student move-ins or placements that we need to do out of district and the transportation costs associated with those students, changing student needs, our state and federal funding, and any litigation that the district might be involved in. So those are kind of the same list yearly that we continue to always monitor, but that we look to tailor for each year based on the situation. So if we review our FY21 budget, the tax supported appropriation is 43.5 million. Again, this year we continue to look at the costs related to staffing and substitutes due to COVID-19, the cost of PPE and other needs to enhance the safety and mitigate the risk of our learning environment, the costs and options to increase the amount of in-person learning. So we talked about that today. That continues to be an evolution. The state did release that supplemental money, so we were able to increase the amount of in-person learning. So we're always looking for what that next revenue stream might be and what it allows us to do. We are continuing to look at the class sizes in both the hybrid and remote settings, as well as our special education classrooms, our special education placements, what aids we need, and then our other curricular needs. So our FY22 identified needs, so what you see built into the budget request before you, we have our contractual obligations. As we said before, all of our unions are under negotiation, so we do have funding that's carried for potential agreements in management reserve, but that exact dollar amount obviously isn't calculated at the moment because we don't know what those agreements will be. Usually you would see a number here based on what contracts we had under agreement. Staffing changes, as we said, minimal for this year. There's $20,000 for the aide at Highland School. Retirements, we see savings of $137,000 based on the 5 retirements we know of from educators for next year. Special education, there's an $87,000 increase. Again, that's net of the one-time use of the circuit breaker excess revenue of $167,000, or that number would have been higher. We have other non-salary needs of $47,000, which includes licenses and software increase as we move to more cloud-based applications and inflation in different pieces of software that we have. We've this year, based on a resignation of our athletic trainer, we moved that service from being an employee of the district to contracting with a private company. So you'll see an increase in the budget for that. But correspondingly, there's no health insurance, there's no retirement expenses, there's other savings that are seen in other parts of the town budget. Elementary science workbooks, and then our elementary math enrichment. So we introduced a program, ST Math, that the students are using that we think is important to continue for next year to allow for enrichment as we move back and try to continue to accelerate students' learning to make up for some of those deficits from the past calendar year. Transportation, again, as we talked about, there's a minimal increase there based on our contractual agreement with Salter Transportation. So if we look at our allocation of budget costs for the upcoming year, these percentages stay the same as last year. We are a people-based organization. So you'll see that approximately 82% of our money is spent on salaries of all of our staff. And then you look and it's really about 6% of our money that's spent on other items and instructional book supplies and equipment. So we have a lot of fixed costs built into our budget. The proposed budget for next year is $44,763,717, which is a 2.9% increase. Again, when we come back in March, we'll be providing you most likely with a memo, fine-tuning those numbers as we look at other revenue sources to help balance the town-wide budget, but the priorities that we just outlined should remain the same. If we look at our per pupil expenditures, in FY18, we spent just below the state average. In FY19, we were just above the state average. So we continue to hover right around what the average spending is per student. As of February 1st, the FY20 data has not been released. So there is a significant delay in that, as there's a financial report that's completed by the business office that gets submitted to DESE that has to be audited. And the same thing happens in all the communities across the Commonwealth. So there is a delay before that data for last fiscal year is released. If we look at our state aid over the past 5 years, you'll see that our state aid continues to decrease as a percentage of our overall funding. So for last year, for FY21, or the current year that we're in, it was 16.3%, or $7.1 million. we continue hopeful that that number will increase, but remain cognizant to the new funding formula that just got rolled out last year through the Student Opportunity Act that is putting primarily most of the dollars towards lower income districts while maintaining the base for public school districts. So depending on the rate of our growth, we may see this number continue to decrease slightly in the coming years. On our next slide, we just present this differently in a pie graph format, but the same data. So again, you can see the trend going from 17.2% to 16.3% over the last 5 years. As we look at our budget increases, we look at it over the life of our strategic plans. You'll see that our budget increases have ranged anywhere from 1% to almost 5% over the last 10 or 11 years. The 12-year average is 3.08%. So for FY22, looking at a 2.9% increase leaves us right around that average, slightly below, in line with what we've had in past years. So again, just to summarize, our budget request for FY22 is $44,763,717, or a 2.9% increase over FY21. I think at this point, we'll turn it back to the chair for any questions.
Great. Thanks, Keith. Eric, would you like to start?
Sure. There's not a whole lot to ask looking at this budget. There's really, you know, we talk about being in bare bones. Now we're starting to cut into the bone a little bit. There's just, when you have a budget that has a net, you know, one position increase and that position is an aide, there's not an awful lot to argue about. You know, some textbooks. Obviously, most of what we're spending is contractually obligated. I would ask just when it comes to the athletic trainer services, it's obviously going to save us some money, but how are those services delivered? Will there be someone assigned to the high school? Will there be multiple people who rotate in and out? Do we get, you know, whoever is available on a given day or for a given game? How does that work, Keith?
So it's a contract that we sign, so they will guarantee us somebody every day. We do get to interview and hire who that individual is. So it is a consistent person.
Okay.
On a daily basis. If that person is out sick, though, they become responsible for providing that substitute coverage if they can't, you know, if the person's not available.
Yeah, I mean, other than that, I mean, you know, it's always the unknowns when you get this close to a budget and, you know, trying to find places to cut to account for the unknowns. We had 10, I think you said 10 outplacement special ed students move into the district this year.
Well, that was actually during the 2019-20. That's what we implemented for the fiscal year. But we bridged that gap over a 2-year plan to help fix that base. So next year will be the second year of that plan.
Yeah, the thing you never know what that looks like year to year. You try and anticipate, but you know, there are some unknowns in any budget that can really put a strain on this. So I compliment all of you for coming up with a budget that, you know, does what we can do based on the likely resources available, and we hope we'll have more resources. But honestly, there's just not a lot to ask in this budget. So thank you.
Great. Thanks, Eric. Arthur?
Yeah, I really don't have much to add other than what Eric said. I mean, the only thing that I think I want to ask is, what do you think is going to happen with the town between now and town meeting? Do you think we'll be able to cover what we need to cover?
I do. So we've had multiple conversations with the team. It's always a team approach, which I am eternally grateful when I talk, especially to my peers, that it is not that way in every town. And I talked with Rodney on Friday for the inside scoop before tonight and our official meeting tomorrow. And we're confident that we'll be able to balance the budget and make it through FY22. And there's a little bit of fear of what FY23 even will look like as those local revenues then hit free cash and what that does to warrant articles, which is why we're trying to be prudent with the ESSER 2 money to make sure that we're not spending that all up front, so that we have ourselves in a good position should FY23 look worse, that we have the ability to continue educating in the way that we need to and not making drastic cuts.
That's, Eric pretty much said. I don't, there's not really much to talk about here other than we're just trying to maintain what we can maintain what we have, and not have to worry about cutting anything. And so, I mean, for this year, I think I'm glad we don't have to cut anything. So for now, that's it. Thanks.
Great, thanks, Arthur. Jeff?
Yeah, I mean, you look at the line items, there's a whole lot of zeros, meaning there's not a whole lot of change year to year. I mean, just, we go over the tuition outplacements every year, but so we're spending an average of $52,000 per student now. If in fact we're spending 3.4 million. And so I think I know the answer to this, but just remind me again, are we getting $52,000 worth of value for every one of those outplaced students that we have this year in COVID, or are we still having issues with not getting the level of services we believe we're paying for?
So the average cost is actually higher than that, because the 3.4 million is a net number of approximately 1.2 million that we're spending in circuit breaker funding. So the total expenditures on out of district tuitions on a yearly basis is closer to 4.6 million. But to answer the second part of the question, we have had accountability practices in place, and we've worked with individual providers to make sure that they're providing updates on everybody's individual education plan, whether that be remote or in person. And it's been better, as with all of us, right? As we get used to having to live in this world, is that we continue to evolve. And we've seen our special education schools also continue to evolve to make sure that they're educating the students the best they can with the hand that we've been dealt.
All right, because I mean, that's 10% of our budget, right? So I mean, 10% of our budget is there, and if my hope is that we are getting good value and good services for that. I know there was some question at the beginning of the pandemic that maybe wasn't happening, but as long as we're sure that those students are getting kind of what they deserve, then that's fine, and that's where we'll continue to do so.
And over the past 5 years or so, I would say we've looked to what programming that we can bring back in district to that end. And so we've added language-based classrooms. We've added an ASD classroom at Thorpe, some therapeutic learning classrooms at the elementary level. So we'll continue to look at how we create the programs that the kids need, as long as we can do it in the most, in an efficient manner that provides the kids with the education that they need in district.
Yeah, because I mean, you can't do everything, and there are a lot of very difficult special services that you need, and I don't think anybody questions that. It's just in this particular time when there's so much stress among all students, just to have that sort of available and make sure we're still getting that makes sense. So that was the only question that I had for this. That's all. Thanks.
Great, thanks, Jeff. Mary Beth?
So like everyone else is saying, there's not much to question other than, is it enough? Is it enough for next year? Is it enough to support staffing that we may need for next year? I'm, just coming, hopefully we're all back in person next year, but knowing what students may need, like, is it enough, Keith? And a lot of times when we do go to FinCom, they'll ask that same question, is it enough? So I know we're a team player. We work with the town on this, but it is our responsibility as a committee to make sure that we're providing a budget that's going to allow us to do what we need to do for all our students.
I would say that it provides the solid base that we need. And again, that's why that second pot of ESSER stimulus money, we strategically not tapped into during the FY21 year. So that if we need those funds in FY22, because we still have a remote learning program that we need to run, or there are acceleration pieces that we'll be looking to do those other extensions through the ESSER money next year, and then we're continuing to monitor what the federal government puts out for stimulus packages in the future. We're in a better position for next year because we know more than we knew 9 months ago as we were doing this. We know what the funding is that now we'll have for that stimulus money going into our planning process. Versus last year, it was a lot of unknowns of we were trying to plan with a, blank check that we didn't know if it was going to be $10 or if it was going to be $200,000, right? So it kind of tied our hands, and this time we're at least going in with our eyes more open to be able to plan. So I would say it provides for the base that we need, right? Of course, there's always programs that we would love to implement, but this isn't necessarily the year to implement those, and that's okay. And we'll build those in future years. And in the appendix section of the budget, there is a multi-year budget request, so you get to see some of those insight of what future year requests could look like as we look to build new programming.
Yeah, and I again just want to make sure we're not doing a budget that's, it doesn't give us a lot of wiggle room. That if you come back to us after your meetings with the town and say, oh, well, we have to do, and I know you've talked with Rodney, but again, I just want to make sure we're not cutting not unnecessarily, but just cutting and then putting ourselves in a situation where then we're like, where's the money? What is the money that we've received from the stimulus? Do you know?
So the ESSER 2 money is approximately $1 million. But again, it's good for 2.5 school years. So it is a significant amount of money, but it is a significant timeline as well to be spent on. Again, there is talk in the latest stimulus package that the new administration is talking about. There's talk about more money to go to schools to reopen them and keep them reopened.
Yeah. That's all that I have right now. Thank you.
Great. Just a couple quick comments. That SR2 money, one of the things we might need to be thinking about is mental health counselors as kids get back to school, having lived through this pandemic and anxiety and everything that goes along with it. So just a thought about that. And a couple minor questions, but my only other real question is on D6 contracted substitutes. We have $208,000 for that. We keep hearing over and over again that we can't get substitutes. Could that be because we're not paying them enough? How do we compare to close districts in terms of what they pay, and should we be looking to pay more in order to get the substitutes that we need given the dramatic shortage?
That's the $1 million question. But what I would say is, when I've talked to my peers in any district, and including Kelly Services, who is our provider, there's no district, no matter what they're paying this year, that has substitutes. So with the way that the stimulus funding is currently working for people that are on unemployment, at the end of the day, people can make more money being at home than they can by coming into work and being a substitute. And oftentimes that's kind of the is that level of pay. So if we increase it $10 a day, I don't believe that it would increase our fill rate. We have explored that and compared our data to other districts that do pay $10 more a day, and they're not having any more luck than we are.
And I get that we're in a unique situation with the pandemic and people, getting that extra unemployment and not wanting to take the risk of coming in when they can stay at home and make the same, if not more money. But hasn't this kind of been a kind of trend that we've had difficulty getting substitutes the last several years? And do you think the money could be a factor there?
It has, and we did increase what we paid the substitutes last year or the beginning of this year. So we did increase it recently in recognition of that. But if you look back even over the last 10 years, you'll see a direct trend to how the economy is doing and what our substitute fill rate is. So the better the economy does, our substitute fill rate goes down because it's harder to attract and retain people in that line of work. And when the economy isn't doing so well, that pool of people increase. So it just continues to follow that trend. So I don't think we could ever get to a dollar amount that would fix that would be financially prudent at this point.
Okay, makes sense. Just wanted to make sure it's something we were looking at, again, because we keep hearing of this shortage of subs, and this year's an anomaly, but it's been a trend. Anyone else on the committee have any follow-up questions? Mary, do we have anyone from the community with questions?
We do not.
We do not. Okay, great. Well, I guess then we need a motion.
Move to close the public hearing.
Second.
Okay, we have a motion and a second to close the public hearing on the budget. Diane, could you do a roll call, please?
Dave Thompson,
Yes.
Eric Crane,
Yes.
Jeff Kay,
Yes.
Arthur Scamus,
Yes.
Mary Beth Ferry.
Yes.
Okay. Eric, do we need a new motion to go back into?
No, you've closed the public hearing. We're back in session, I think. I mean, you can just unsuspend the regular meeting.
All right, we are out of suspension. All right, so unfinished business. Only one thing, which is the independent review of Danvers High School culture and climate update, which is me. And I am happy to report that the independent investigation that the school committee authorized back in September was recently completed, and the people involved are in receipt or about to receive the final report to review. So that's where that stands as of tonight. So we will move on to order of business communications. Dr. Dana.
Thank you. You have the link to our North Shore Education Consortium, and the board, in working with our executive director and business manager, are in the same spot of putting together the FY22 budget. So we will have that for you in April.
Great, thank you. Eric, legislation?
The no particular, say, bills to talk about, but it's very clear that both Governor Baker and the Biden administration are committed to getting students back in school at various levels as soon as possible. We talked in the workshop, though not, I don't know we talked about it as much in regular session here, about the difficulty that the state has had so far getting the website working, getting people to get appointments, and hopefully that's going to change. Hopefully that will start to change so that it moves more smoothly and we'll get people vaccinated sooner, and especially our educators. So basically that's what's going on. And I know that the School Committee Association and other school committees and towns are pushing to try and get teachers to have priority, educators to have priority. And that will continue, and I say hopefully we'll get there.
Great, thank you. Moving on to subcommittee updates. Deep, Mary Beth.
Last month on January 26th, Deep held the 12th annual Holton Richmond Deep Spelling Bee. Out of that, we have Mohammed Kam, who placed first. He went 11 rounds. His winning word was authority. Mohammed moves on to the next round is a spelling test, a written spelling test to qualify for a regional spelling bee. And we wish Mohammed luck on that. And the runner-up was Casey Jimenez. She was a runner-up this year to Mohammed. I want to thank all the sponsors and businesses that helped sponsor this year's bee, including Cherry Farm Creamery and Danvers House of Pizza. I also want to thank Ellen Ferrick, curriculum director at the middle school, and Mary Wormers for coordinating in the bee and the logistics of it, because it was held virtually, and Adam Federico and the volunteer judges for supporting this year's bee. I also want to just take a moment to talk about DECA. The District 3 DECA competition was recently held. Over 800 students across District 3 competed. This was also, winners were announced virtually, and Danvers had roughly over 250 students participate, and just over 170 students placed. So they will move on to the states that will take place between March 1st and the 18th. So we're wishing them good luck there. And if they place out of that, they will move on to the international competition at the end of April. DEEP is a supporter of the DECA program at Danvers High, and want to thank all the DECA coordinators, teachers, and the students. Also today, the community would have received an email. The DEEP quarterly newsletter went out electronically. So if you have a moment to take time to take a look, there's some good information as well as some information from our DEEP sponsors this year. And again, just want to thank everyone for their support of DEEP to help us help support the Danvers Public Schools. Our next meeting is this Wednesday at 8 a.m. If folks are interested, they just need to send an email to deep@danvers.org requesting the virtual link. That's it. Thank you.
Thanks, Mary Beth. Jeff, over to you for Danvers Cares.
Sure. So Danvers Cares just had our last meeting last Monday. And so pretty full slate of things that we discussed. One was pandemic fatigue and some of the support that's available for students and for others as far as that is concerned. Lectures on bullying, regional youth group plan, tips training is happening again for some of our businesses. And I did want to highlight this, and Dave, you can as well, that the Teen Health and Safety Guide ad registration is open. So for any of our local business community, please reach out and we can help you with that as well. That's
Great,
it.
thanks, Jeff. Dr. Dana, CPAC?
Thank you. CPAC held a successful online training and support for our parents, and it was entitled Supporting Your Child Through Remote Learning back on January 14th. And we thank the Commonwealth Learning Center for presenting and sharing information with our families. Alicia and Amanda continue to work with Dr. Tatum in reviewing the concerns that parents may have, and also looking at professional development and different types of parent training. So there'll be more to come this school year. So again, we thank Alicia and Amanda, our co-chairs, for all of their efforts in putting together programs for our parents to support our students. And they also have the Facebook that has up-to-date information at any time.
Great, thank you. Policy. Arthur, anything on policy that I'm not aware of?
Not yet, Dave. Maybe soon.
Yeah,
Yes, we will be setting up a meeting for the next month. Thank you.
great.
It's time.
Yes. Not that we mind the break, but it probably is time. Eric, Human Rights and Inclusion.
Our last meeting was on January 21st. Among the topics was a presentation by a resident in town, Lisa Silva, who told us about an online forum that was held through Swampscott, which dealt with inclusion and how things can improve in that regard, and allowed people from town to comment on how they felt things were going, to talk about how they thought things were going in their town in a facilitated kind of way. And so the committee discussed the possibility of doing something along those lines. So there's more to come on that. The debrief of the MLK event was welcomed. Actually, I shouldn't say event, the video event that was held by DCAT was well received, and people were very complimentary of the student artwork, the student presentations, and generally the work that DCAT did was much appreciated. Everyone's a little sorry, obviously, that we couldn't do it in person, but as a substitute for this very unusual year, it was extremely well received. The committee wants us to consider whether we could appoint a student liaison to the diversity committee, the inclusion committee. So that's something that I would suggest that Dr. Dana perhaps talk with the high school administration about, and who that right person might be. And then I can report back to the committee. And we also talked about picking a date for our next subcommittee meeting for the education subcommittee. And if you haven't heard from someone already, sir, I expect you will very shortly. Our next meeting is on February 22nd at 7 o'clock, and that'll also be by Zoom.
Great. Thanks, Eric. And I'm going to stay with you for the minutes.
I move that we approve and release the minutes of the January 11th, 2021 regular meeting and workshop, as well as to approve and not release the minutes for the January 11th, 2021 and January 26th, 2021 executive sessions.
Second.
Okay, we have a motion and a second. Any discussion on the minutes? Hearing none. Diane, can you do a roll call?
Dave Thompson,
Yes.
Eric Crane,
Yes.
Jeff Kay,
Yes.
Arthur Scamus,
Yes.
Mary Beth Ferry.
Yes.
Great. The minutes, motion for the minutes is approved. Keith, any updates here on budget and donations, please?
So before you have the monthly budget report for January, I was about to say December, I was dating myself for January. Happy to report we remain on budget as we move into the second half of the year. Also attached, you have the annual grants update. So you'll see that we did have our skills capital and our project lead the way grants end, but you'll see the introduction of the CVRF and ESSER 1 grants, which is the pandemic relief funding, as well as small increases in our entitlement grants. And then for donations, I am going to just ask Mary real quick to pull up a picture for us. We would just like to say thank you to Garrett Dunn, who went through the Smith School and through our elementary schools. He now goes to the prep, but he made these ball bins for each of our elementary schools as his Eagle Scout project. So we'd like to thank him for his hard work and his dedication to the process and for thinking of us when it came time to do his project.
Those are really cool. Any questions on budget or donations for Keith?
Just want to thank Garrett for doing that for all the schools. That was awesome. And congratulations on the Eagle project.
Yeah, that's very cool. Keith, we'll stay with you for personnel.
And then the monthly personnel report, just miscellaneous hires and leaves, and Jeff Liberman and Tom Powers' official retirement from us. So we wish them again best of luck and look forward to working with Jim and Emily, who are coming in to be their successors.
Great. Any questions or comments on personnel for Keith? Nope. Just again, congratulations and to Tom and Jeff, and hopefully they will enjoy every minute of their retirement. That is it on the agenda here. Go ahead, Mary Beth.
I just had one more comment actually, and I should have said it earlier, but I just want to, we met prior to Chief Ambrose passing away, and I just wanted to extend our condolences to his family and thank them for sharing him with us. He was a huge part of the police department, but worked with the schools and Danvers Cares and the diversity or the Human Rights and Inclusion Committee. So I just wanted to extend our deep condolences to the family.
Yeah, thank you for doing that.
Yeah.
Yeah, we should have done that at the beginning of the meeting. He was a great guy. I look forward to seeing him monthly at the Danvers Cares meetings prior to his retirement. And such a sad story. So thank you very much for that. I wanted to mention that our next meeting will be 4 weeks from today, March 8th. And as of now, with the in-person restrictions still at 10 people, we will be meeting remotely as we did tonight. If that changes, that will be announced on the agenda. And if there isn't anything else, I would be looking for my favorite motion of the night.
Sure.
Second.
All right, we have a motion to adjourn and a second. I assume there's no discussion. Diane, can you do a roll call?
Dave Thompson,
Yes.
Eric Crane,
Yes.
Jeff Kay,
Yes.
Arthur Scamus,
Yes.
Mary Beth Ferry.
Yes.
Great. The motion to adjourn approved. Thank you, everyone, for such the long meeting, and good night, Danvers.